The House will come to order. Report from the Committee on Rules and Legislative Administration.
Long from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Monday, May 1st, 2023, and establishes a pre-filing requirement for amendments offered to the following bills. Senate File Number 1384, House File Numbers 782 and 1234.
Calendar for the day. The first bill on the calendar for the day is Senate File 2744. The clerk will report the bill.
Senate File Number 2744, number 2 on the calendar for the day, an act relating to commerce, the unofficial engrossment.
I recognize the member from Anoka, the author of the bill, Representative Stephenson, to explain the bill.
Thank you, Madam Speaker and members.
Members, please take your conversations off the House floor. Even Representative Erdahl, please take your conversations.
Called out.
Please take your conversations off the House floor. Representative Stephenson.
Thank you, Madam Speaker. Thank you, Representative Erdahl. And thank you, members, for allowing me to bring before you the Commerce Budget Bill. We had a great committee this year, and I'm really proud of the work product that we're bringing before you, and I want to thank the members, both the DFL and the Republican members of the committee, for the great work we did in committee and the good, sometimes robust, but always collegial discussions that we had in committee, particularly the lead on the committee, Representative O'Driscoll, who, we had a very good working relationship that I very, very much appreciate, and I really do. We also had phenomenal staff on this committee that worked very hard, our amazing nonpartisan staff, House Research, Lori Pompu, and our House Fiscal, Ashley Eng. We had great researchers on both the DFL and the Republican side, and Eric Anderson, Casey Peterson, and then, of course, our Committee Legislative Assistant, Jack Dockendorf, and our Committee Administrator, Simon Brown, without whom I would be not figuratively, but literally lost, I'm sure. I would not probably have made it to the chamber today. I would be off wandering in the wilderness. So thank you for that. I just want to highlight a couple of provisions in the bill. I think we're going to have a good discussion about some other provisions in the amendments discussion, so I'm going to try and stick to the ones that aren't going to be big amendments with a few exceptions. Number one, this bill is so critical to tackling the problem of soaring prescription drug prices that so many of us hear from our constituents every day. Members, no one should have to choose between paying the mortgage and paying for their prescription drugs. We need to fix that, and this bill takes some important steps in banning price gouging and creating a prescription drug affordability board, what will be the strongest prescription drug affordability board in the country when we pass this bill. This bill also tackles that problem by including Chair Howard's excellent bill to cap the costs of things like EpiPens and insulin and other chronic conditions that are bankrupting people with the medication that they need to live. We've seen in other places around the country an assault on people's health care, including some tragic federal court decisions targeting preventive health care, things that save lives, cancer screenings, PrEP and PEP. This bill ensures that Minnesotans will have access to those life-saving treatments without the need for cost sharing. That's important. We are going to get across the finish line this year, Chair Cagle's great bill, to put some teeth into our rules on mental health parity and substance use disorder parity. Those protections in law that we have that say that there has to be parity on those treatments are useless if they're not enforced. And so we're going to create a new office to tackle that and make sure we're enforcing the law. We're going to end the terrible and predatory practice of payday lending in Minnesota, which has been a long time battle in this state. We're going to finish the work we started with the Student Borrower's Bill of Rights by creating a student loan advocate to stand up for students and make sure that they're not being taken advantage of. We're going to tackle the problem, one of the defining problems of our time, in my view, which is the experiment that is being run by big technology companies on our children for profit in the form of social media by passing a nation-leading piece of legislation authored by Representative Bonner called the Age Appropriate Design Act. That is a critical piece of legislation that I'm really proud to bring to the floor today, and thank you, Representative Bonner, for your hard work on that. So thank you, members, for the discussion today, and I look forward to it as we proceed.
There is an amendment at the desk. The clerk will report the amendment.
Stephenson moves to amend Senate File Number 2744, the unofficial engrossment. The amendment is coded A9.
Representative Stephenson, to your amendment.
Thank you, Madam Speaker. The A9 amendment makes a couple of technical changes and also reflects some ongoing discussions between the insurance industry and the department in the storm, in the resilient homes language. I'd ask for member support.
Any discussion on the Stephenson amendment? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Fisher moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A8.
The member from Ramsey, Representative Fisher.
Thank you, Madam Speaker. I offer the A8 amendment. This is an amendment to address the digital right to repair part of the Commerce Bill. And this is a collaboration of people who are experts in cybersecurity. One of the things that people have mentioned as concerns about as you address digital right to repair, is there any issues around cybersecurity? And I want to first start off by saying that in 2021, the FTC made a report to Congress that where they had explicitly asked manufacturers to provide evidence that authorized repairs were of higher quality or employed superior cybersecurity than independent repair. At that time, manufacturers were unable to provide any such evidence to the FTC, and the Commission concluded there was no empirical data that supports claims that authorized repair was more safer or higher quality than independent repair. However, in the interest of wanting to work across the lines to make sure that we have a very good bill here and being sensitive to things to give people comfort language, we decided we'd address cybersecurity in here. And in terms of bringing together the definition of cybersecurity, we realized there was no current definition in state statute. And so one of the things that we did is we contacted with national experts on cybersecurity and also with our own Minute cybersecurity experts to try to come up with a definition that they felt was very good to address cybersecurity, because this is the first time we're putting anything into state statute on it. And then the second part of it is some comfort language to help define a little bit more, is that the parts and tools and documentation that are needed for a right to repair so that people can repair their equipment out there does not have to be expressed if it was released if it would compromise cybersecurity. And with that, I will ask for a green vote.
There is an amendment to the amendment. The clerk will report the amendment.
O'Driscoll moves to amend the Fisher amendment to Senate File Number 2744, the unofficial engrossment as amended. The amendment to the amendment is coded A19.
The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members, and Representative Fisher, thank you for your attempts to try to clarify the cybersecurity issues. As many in this chamber have worked on cyber issues, Representative Bonner has, Representative Nash has, and others, we know that cybersecurity is an extremely sensitive issue. We also know that many of the devices that we have, our phones, our computers, other handheld devices, not only can be wirelessly connected now via Wi-Fi and other technologies. If you have a device that you bring into a place to have it repaired, your data, your information could be co-opted. We've all heard of the Bluetooth incidences that can happen. This is simply a way to be able to try to protect not only the company and the customer, but to protect all of us from cybersecurity related breaches. And so what the A19 amendment does, it simply adds to Representative Fisher's language the phrase, unless the original equipment manufacturer determines that it creates a cyber risk. And who better than the manufacturer and the producer of the device to provide us that information as to whether or not that device could have the capability of compromising cybersecurity. And so, members, with that, I ask for a yes vote on the A19 amendment to the underlying A8 amendment.
Representative Fisher.
Thank you, Madam Speaker. Representative Driscoll, thank you for offering the amendment. This is an area that you're addressing on my amendment that I'm still working with people on. I would ask for a no vote on this. First of all, I will say this is an area that we continue to work on with the wording. I've been working with different people, and I think we're getting very close on it. The reason I would ask for this phrase to be rejected, this amendment, is because there's some things in here that we don't have definitions on. Example, cybersecurity risk. We don't have that defined. Another issue that I'm concerned about is while there's some very good people I've been working with on having great intentions and are working in an honest way to bring things together to address this issue, there's some that manufacturers out there that are not always as honorable. And what I mean by that is they could define that a part is no longer going to be made available because they could claim it has a cybersecurity risk when it doesn't. So there needs to be some work in that area to try to figure out how do we get at that part of the issue. And when I say that is I remember that some of the original discussions when we had the iPhones, and we started working on this years ago, you could not get access from independent from our iPhones. And people said, oh, it's security risk. And now you've got the independents that are able to get it. So I think that, first of all, by having these conversations, that gets the manufacturers to continue working on it. And at the same time, it gives us a chance to say, let's make sure we do this the right way. So I understand the intent. We'll continue working on it, but would ask for a red vote.
Representative O'Driscoll.
Thank you, Madam Speaker, Representative Fisher, and members. Representative Fisher, I would ask for a yes vote, and I appreciate your willingness to continue to work on this. This will just, if we add this to the bill, it will remind the conferees when they get to conference committee how important this fact is and act as a reminder. So if nothing else, it's a placeholder that we need to address this language. So again, members, I strongly encourage a yes vote on the A19 amendment to the A18 amendment.
Any further discussion on the amendment to the amendment? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. On the underlying Fisher amendment, any further discussion? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Nash moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A4.
The member from Carver, Representative Nash, to your amendment.
Thank you, Madam Speaker. The A4 removes the language on the right to repair from the bill, and there's a reason why. At your desk, you've gotten a letter that I had sent out from Cisco, IBM, and Hewlett-Packard, or HP Enterprise. Members, I used to work in the enterprise level in IT, and I've spoken to several of the people in our IT caucus here in the House. Each of them have concerns. I talked with Representative Noor last night, who has concerns, and I would like very much to allow folks who want to repair these things to be able to, but from an enterprise technology perspective, the tools and different things that have to be made available to people in order to repair this compromises not just cybersecurity, but also physical attack, as I've said in Ways and Means today. It's a work in progress, and Representative Fisher, you and I have spoken about this, as has Chair Stephenson and I. But I said in Ways and Means of the day, if you remember back to the Andy Griffith show in Mayberry, you had Emmett Clark, the guy that was in Mayberry that would fix your toaster or your blender or your vacuum cleaner. That's great. And I think that there are some electronic devices that can be fixed by somebody, but the training and certification that goes into this, super important. Because if you have somebody come to fix a piece of enterprise tech and they are not properly trained, you're now just going to have a large pile of silicon chips. And what further happens is with the keys and the roadmap and all the different things that will be published, is you make yourself more susceptible to compromise. So would Chair Stephenson yield to a question?
He will yield. Representative Nash.
So Chair Stephenson, we just talked about this and you asked me to ask you to yield to a question. My ask of you before I withdraw this amendment is, Will you work to make sure that folks like IBM, Cisco, Hewlett-Packard, major machine manufacturers feel comfortable with this before you let this bill out of conference?
Representative Stephenson.
Madam Speaker, Representative Nash, appreciate the question and the conversation. We are headed to conference. This is an issue that we still need to work on, and I will work with the stakeholders to try and address as many concerns as I possibly can.
Representative Nash.
Thank you, Madam Speaker. And members, this is not me trying to blow up the right to repair. There are legitimate concerns that are shared by people on your side of the aisle as well. This is not a toaster. This is something that's infinitely more important than that could cause compromise for schools, the state of Minnesota, and many others. But with the chair's assurances that this will be continuing to work on, I would withdraw the A4.
Representative Nash withdraws the A4 amendment. There is an amendment at the desk. The clerk will report the amendment.
Perryman moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A15.
The member from Stearns, Representative Perryman.
Thank you, Madam Speaker, and what an appropriate time for me to back up Representative Nash. And first of all, I'd like to thank all of you members today, because you're going to support my amendment just by bringing what we can't bring in as a speaker or a presenter, props. When you hear my amendment, you all have props on your desk that are going to support this amendment. Just listen, please listen, because you're going to think this is, wow, what a great amendment. It affects you right now. So with that said, thank you for bringing your cell phones and your devices, because that is what I'm going to talk about today with my amendment. What would you do without technology? It touches your friends and families. It helps you stay in touch with your friends and families. And it helps you to know what's working and what's not working and what's going on the house floor. Think of how you feel when you can't find your phone. Just think of that. Think of when you don't know where your phone's at and you can't even like buzz something to find your phone. And when your phone doesn't work, how irritated are you when the phone doesn't work? And devices are used, right, for tools for everyday, normal Minnesotans pretty much. I'm looking at all of you right now on your devices and cell phones. So please, take a listen to this amendment, because I think you're going to agree it is a great fit to Representative Stevens' bill. So with that said and in mind, my amendment would fill a consumer protection gap in the bill by adding a consumer digital repair rights, a consumer digital repair rights disclosure, which would be a requirement for independent repair providers covered by this section. It includes disclosure to consumers of important information, such as whether the repair provider is authorized, the potential impact on the product warranty, whether the technician working on the device is trained, certified, and whether the parts are not from the original manufacturer, as well as the anticipated costs of the repair. Full disclosure. Probably the most important part of this amendment, though, is that consumers will be assured that their personal data on the device will not be disclosed, and any customer data needed for the repair will be deleted. So keep that in mind, the Privacy Act. We will ensure that this amendment has the consumer in mind, This information that consumers need and should be required for consumers to know when turning their device over to a provider for repair. And I'm just going to use me for an example. We have individuals that have come in with their cell phone, and they're telling my certified device repairers, I need my information off of here. I can't get my phone on. They tell me information's in the cloud. What the heck does that mean? And yada, yada, yada. And so the technician takes it in and tells them right up front. And we have signatures on papers and everything to tell them what they're going to do and tell them what the cost would be, and also tell them that if we can't fix it or if we break it, we will replace the cell phone. So all that set up, they crack the phone opens, and there's screws missing, and there's a burnt battery in there, and the device repair person goes, wow. So those are kind of the issues we'll get, but we're always upfront and transparent with the consumer, telling them this could happen. And we also have forms that they sign that say, our Privacy Act, no one will get their information. Even if it's in the cloud, it's still out there on the phone. So we do a lot of transfers as well of information for these individuals that do not know what the cloud is about, where information's stored. We get a lot of individuals coming in saying, can you transfer my pictures over to this new phone? I don't know how to get it going. I could go on forever and ever with the things that do come into our business. So in my business, we are the ones who help you when your phone, iPad, or computer doesn't work. You are frantic and frustrated. You don't want to give up your item, actually. A lot of individuals will come in and you got to take it for 45 minutes. I'll just sit here and watch you while you do repair it. Those devices are so personal to everyone that it's like giving up I don't know, something very personal that you never want to give up. My family owns a Batteries Plus franchise. You probably all know that by now by some of my speeches. And we are an authorized repair provider for Samsung and in the process for Apple right now. We have other companies that we are certified for, but they're not as big players as Samsung and Apple. And why are we certified? Because my corporation, my franchise, insists on it. I cannot be a Batteries Plus bulbs store without sending my people to Milwaukee for a week to learn how to do this. I buy libraries worth of instructional videos, and these guys, I put a lot of money into it, but it's really worth it because we are the preferred individual. I'll say it out loud. We're the preferred individual to repair cell phones and iPads in St. Cloud, and we get a lot of accolades. It's because we do it right, and they trust the plus. No pun intended there. To provide authorized repair, we go through, as I said, significant training and have requirements we must follow, or there are consequences. I could lose my store if I do break the consequences that we are under contract. And as I said, it's costly, and it costs some money, but to me, it has been worth it. We also know, because of the money we spend, we also know that we are providing the best possible repair services to our customer. Our customer is number one, whether it's selling or fixing. Most of our customers are unfamiliar with the process and consequences of technology repair. I gave you some examples earlier. The purpose of A15 amendment would empower consumers of electric equipment to effectively advocate for themselves. I want to repeat that. It would empower consumers so their electric equipment and they can effectively advocate for themselves, as well as ensure they understand the repair process for their devices and that the data on their devices is protected. So a lot of transparency and a lot of disclosure right up front. So with that said, I am a proud device repair person. My story is, I have to say, I went through training myself. All the owners have to go through training themselves. I don't try to touch it, but I know enough of where we're going. So with that said, look at your phones like you all are. Look on your devices. Remember everything I just said, because you're going to need this disclosure soon, and I'm going to ask for a roll call. Speaker?
Representative Perryman requests a roll call. Seeing 15 hands, there will be a roll call. Further discussion to the Perryman amendment. Representative Fisher.
Thank you, Madam Speaker. Thank you, Representative Perryman, for bringing this forward. I really appreciate your interest in making sure that we have good consumer rights protection. And as I've taken a look at this, I see some really good things in here. It feels a little narrow, and I can see some things where it could be a little bit broader. As I see independent repair provider, in consumer protection, we'd like to see would like to see all repair providers covered by that. And also, I'd love to hear from consumer protection rights groups. I know that we've worked with some of those in the past. I'd like to make sure that we get their input in the process. So I think this is something that sounds like more of a robust bill that we should come back with next session. And I'd like to say I'd be willing to work with you to bring that bill back and also involve some of the consumer rights groups to make sure that we're getting this done right. So thank you for bringing it forward. Want to say we need more work on it. Would ask for a red vote for now.
Any further discussion on the Perryman amendment? Seeing none, the clerk will take the roll on the amendment. Will the clerk please call the name of the member who's participating remotely?
Richardson.
Richardson votes no.
Richardson. Louder.
Say it a little louder.
Richardson votes no.
Richardson votes no.
The clerk will close the roll.
Okay.
There being 58 ayes and 71 noes, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
O'Driscoll moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A10.
The member from Stearns, Representative O'Driscoll, to the A10 amendment.
Thank you, Madam Speaker and members. The A10 amendment addresses a provision that talks about requiring health insurance companies to, when determining premiums and costs, to calculate the costs and project those into the future in their actuarial projections of costs of premiums, what would happen by adding mandatory coverages here in the state of Minnesota. Thankfully, last year, this body passed and this legislature passed a review process to determine what the mandates might be going forward in insurance. And the part that's really kind of the sticky part on this is that it asks for a 10-year projection as to what the insurance companies feel costs would be to them and to premiums and to insureds as a result of a particular mandate. Having worked in the insurance industry and worked in many of Minnesota's various regulated industries, I can tell you, you will not find an actuary who will put their name on the bottom line and say that something is good for 10 years, 5 years, 7 years. In the insurance business, you're lucky to get 1 or 2 years. It's one of the reasons why we had the reinsurance program, was to be able to give actuaries a little bit more of a balance to be able to make those kinds of determinations. With this particular amendment, the Department of Commerce, I understand, is just going to collect the information. They're not going to be doing anything with the information. And I'm just wondering why we're collecting information and increasing costs on the insurance companies, which get passed on in premiums to folks. Wouldn't that money be better off used to provide reimbursement or to pay for care for individuals than for bureaucratic requests by government when they're not going to be worth the paper that they're written on? So, Madam Speaker, I would encourage folks to vote yes on this. But before we do that, I suspect that the bill author may want to weigh in on this. But before he does, Representative Stephenson, my question to you is, would it be easier for you in conference committee if we adopted this to remember that this needs work, or we'd be jotting down some notes and I can withdraw this amendment so we don't need to take it up today? Which do you think is most preferable?
Representative Stephenson.
Thank you, Madam Speaker. And Representative Driscoll, that is a really tough question to ask me if I want you to withdraw an amendment to my bill. No, I appreciate the conversation. I just want to acknowledge the good work, the good bipartisan work that's been going on around these mandate benefit review processes that have been largely retrospective. So far, this is an effort to try and be a little bit, continue the conversation after the mandate is adopted. I do think that this provision merits further examination for some of the reasons that Representative O'Driscoll talked about. So I commit to continuing to work on that and having that discussion in conference. I do think withdrawing it would be my preference.
Representative O'Driscoll.
Thank you, Madam Speaker, and Chair Stephenson. In light of the working relationship that we have had on the committee and the impending conference committee on here, I will withdraw the amendment, but we are not withdrawing the concept or idea for discussion. Thank you, Madam Speaker.
Representative O'Driscoll withdraws the A10 amendment. There is an amendment at the desk. The clerk will report the amendment.
FAR moves to amend Senate File number 2744, the unofficial engrossment as amended. The amendment is coded A12.
The member from LeSueur, Representative Farr.
Thank you, Madam Speaker. The language as it's written in the bill now singles out less than 10% of our state chartered banks and credit unions, while their nationally chartered counterparts are not required to do these surveys, thus creating a disadvantage for our state chartered institutions. And so the A12 would keep our financial institutions of a similar size on an even playing field by making this language effective once nationally chartered banks and federally chartered credit unions of the same size are required to submit climate risk surveys. The federal banking agencies have issued proposed climate guidance and are currently reviewing feedback, actually including stakeholder input. And Minnesota should allow them time to finalize their rules, and then we can apply them equitably. This would be the correct way to implement this legislation. At a meeting this winter with stakeholders, we learned that the Department of Commerce didn't come up with this idea. We don't know exactly what this risk survey is going to look like, nor do we know what we're going to do with it. And like everyone, financial institutions would appreciate knowing the regulations they must follow and have the time to prepare to comply. This language, as written, gives no guidance or limitations as to what the survey would or could entail, how burdensome it might be to our state chartered institutions, and again, includes no stakeholder input. There's no way to estimate what new staffing needs will be required or costs that may be incurred. Minnesota would be the only state in the country to have adopted this and asking its financial institutions to complete a climate risk survey. So with that, Madam Speaker, I ask for a roll call.
Representative Farr requests a roll call. Seeing 15 hands, there will be a roll call. Discussion on the Farr amendment. The member from Hennepin, Representative Kraft.
Thank you, Madam Speaker. Thank you, Representative Farr. I'm going to ask for a no vote on this. Climate change is impacting now and will impact all aspects of society. The underlying language is about putting in place a process to evaluate the climate risk of institutions critical to our economy here in Minnesota. The amendment would basically mean that we never do anything in Minnesota because national banks are at a different scale than Minnesota chartered banks. The underlying language is not about creating a process that mimics what national banks have to go through, but to put in place something that's appropriate for Minnesota, that's forward-looking, and protects our financial system from stresses due to climate change. The insurance industry already goes through a similar process.
The member from Stearns, Representative O'Driscoll.
Well, thank you, Madam Chair. And members, I want to put a little bit more background on this. When this particular bill came to the Commerce Committee, Commerce didn't even know really that it was coming, meaning that they didn't ask for it. It was a bill that was introduced by a member. And right now, the provision that Representative Farr was talking about, applying to federally chartered banks of $100 billion or more in assets. This bill and this provision says $1 billion worth of assets. And so in committee, I started asking the question, well, who does this apply to? And how does this work? And it was like, well, we just think it's good information. And Commerce, when I asked them, what are we going to do with this information? Once again, it was, well, if we have to get the information, we'll collect it. I said, are you going to be putting a report together? Well, no. What are you going to do with it? Well, we're just going to have it. I said, how are you going to be able to get that information to the public if they're inquiring about it? Well, we really don't know because, again, this isn't something that we specifically had asked for, so we're not quite sure about this. So it kind of stuck in my craw, so I began to do some research on it, and there should be a flyer coming out to your desks here from the pages shortly if it isn't already on its way out. So I've done some research to find out which financial institutions in the state of Minnesota this applies to. And there are actually 19 financial institutions that this applies to. State-chartered banks and state-chartered credit unions. And again, credit unions are those financial institutions that cater to lower and moderate income individuals. And so the first thing I did was I looked at the list and said, how many of these are in my district? And I found out that one of them was in my district proper. And I started looking, I said, well, how many are in Representative Dama's district? And she doesn't have any. And I started looking, well, let's get out to like Foley from central Minnesota area, and there's one where Representative Schultz is at. And I started looking, and it's like, well, Representative Perryman, she's also in our area, and she has two of them on the list. And something that I found that was just amazing, and it just blew me away when I was looking at this, that 25% of the institutions that are on this list are in Representative Wolgamont's district. And I was wondering if Representative Wolgamont would yield to a question, Madam Speaker.
Representative O'Driscoll, just a reminder that our remarks are about the substance of the amendment and not individual personalities. He will yield. Representative O'Driscoll.
Thank you, Madam Speaker. Representative Wolgamont, my question to you is, do you feel that we should be working with our folks in the central Minnesota area on trying to find a way to increase this number, to put them at a more competitive rate with those that are at the federal mandate on here?
Representative Wolgamont.
Thank you, Madam Speaker. Representative O'Driscoll, I have to admit I was responding to a text message from a constituent about something else during your previous remarks. So if you could perhaps repeat the context of the question that you're asking, I'll be sure to give you my full attention and be able to give you an honest answer, Madam Speaker. Thank you.
Representative O'Driscoll.
Well, thank you, Madam Speaker. And Representative Wolgamont, this is a legitimate question because you and I attended a lot of the same chamber meetings where a lot of the folks are experiencing the same kinds of issues and same kinds of stresses. And I'm just thinking that if we spend less money on reports that the Commerce Department didn't ask for, that perhaps the folks at the credit union, the customers, the members is what they really are, and the customers of banks could get a higher rate of return on their savings or checking accounts and their certificates of deposit, or a lower rate on their loans. And Representative Wolgamont, I won't ask you any more questions, but I just was very curious when I saw 25% of those institutions do business in your district out of the 19 that are here. It's not a get you, gotcha. It's just like, wow, we try to work together as a team in central Minnesota, so I didn't have a chance to talk to you about it, so I just thought I would ask the question here today on the floor. And I concur with Representative Farr that we should have a green vote, and he did ask for a roll call if I'm not mistaken, so thank you, Madam Speaker.
Any further discussion on the Farr amendment? Seeing none, the clerk will take the roll on, Representative Farr.
Thank you, Madam Speaker. So just to some clarification here. So this amendment is about parity in the industry. That's what it's about. We heard this this winter in stakeholder meeting. You know, we don't know what this looks like yet. There's no definition of this. We don't know what we're asking of our financial institutions or what we're going to do with that information when we do gather it. So again, we should not pass laws that devalue our state charters, because that's what I fear will happen here. We continue to hear how nationally chartered institutions are changing over to state chartered institutions, and I think that's good for the state and good for the Department of Commerce. And I wouldn't want to discourage that trend by singling out a handful of financial institutions. So with that, I ask for a green vote.
Representative Farr has concluded. Any other discussion? The clerk will take the roll on the amendment. The clerk will close the roll. There being 59 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
O'Driscoll moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A6.
Representative O'Driscoll to the A6 amendment.
Thank you, Madam Speaker and members. The A6 amendment deals with a provision in the bill that terminates the insurance company's ability to be able to do underwriting for Medicare supplements. If you recall back at the time that the ACA was adopted, that similar type of action was taken, and we know what happened to insurance premiums in the individual market. They skyrocketed. I mean, they went up so much that Minnesota instituted a national leading reinsurance program to be able to try to deal with those premium costs here in the state of Minnesota. What my fear is just that we're going to instill fear into the hearts and minds of retired persons who are trying to purchase these Medicare supplements. On the surface, it looks good, no underwriting. But when you get the price tag on that, just as we have seen, when you start pulling the guardrails out, the costs are going to catch up, and the market eventually does find equilibrium. The last thing that I want to see is a senior tsunami surrounding this issue of the Medicare ACA equivalents. And so, members, I strongly encourage you to support preservation of the market by allowing underwriting in a market that's generally working very well, and a market that is generally working to provide the benefits that are needed to support and supplement Parts A and B of the Medicare program in our country. And not only that, if we want to try to help folks, let's offer them a tax deduction for the premiums that they pay on those Medicare premiums. Let's be leaders in the state of Minnesota on that front in providing tax relief. So, members, I ask for a roll call and a yes vote on the A6 amendment.
Representative O'Driscoll requests a roll call. Do I see 15 hands? Seeing 15 hands, there will be a roll call. Discussion on the amendment. Representative Stephenson.
Thank you, Madam Speaker. I ask members to vote no on this amendment. Senior citizens, just like everybody else, deserve to be able to get medication even if they have a pre-existing condition. That is a value that Minnesotans hold. We are going to protect people with pre-existing conditions, and the way to do that today is by voting no on this amendment.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. Elkins? No? He doesn't have to vote. Fine. The clerk will close the roll. There being 59 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Scott moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A7.
The member from Anoka, Representative Scott, to your amendment.
Thank you, Madam Speaker, and I want to thank the bill author of this genetic privacy piece. She did a lot of hard work on this bill and took many of our suggestions, was really good to work with. The one thing that we couldn't come to agreement on was the complete definition of what genetic data means. Now, if you look at page 174 and 175 of the bill, you'll see that genetic data means any data, regardless of the data's format, that concerns a consumer's genetic characteristics. Genetic data includes, but is not limited to, raw sequence data that results from sequencing a consumer's complete extracted DNA or portion of the extracted data. Then there are several other items that are included in the definition of genetic data. And my concern is that I don't really understand how you truly de-identify someone's genetic data. And so what my amendment does is says that genetic data does include de-identified data. We all know that when we voluntarily pay to have our genetic data looked at through one of these companies, that there are a lot of choices that a consumer has to consider. And the industry is doing a good job, a relatively good job, of offering some of these things and having individual boxes to check. Yes, you agree to have your data shared for this. No, you don't agree to have your data shared for that. But there's no choice when it comes to your so-called de-identified data. It can be used for multiple reasons, and you cannot opt out of that. And members, I think that it's really important, again, because it's super difficult to de-identify genetic data. It can always be traced back to you in some way, or one of your relatives, and then find its way back to you. So members, I would ask for your support on this amendment. It's just, adding that a simple fix, adding that de-identified data is part of the definition of your genetic data. I ask for member support. Thank you.
The member from Washington, Representative Hemmingson Yeager.
Thank you, Madam Speaker. Thank you, Representative Scott. I've really appreciated all of our discussions. I've really appreciated, being a newbie, having your insight, and having the time and the interest in talking to a newbie like me. So I very much appreciate that too. So this is a very narrow scope when it comes to genetic data. This focuses specifically on the direct-to-consumer genetic testing market. And Representative Scott has it absolutely right. These are people who are willingly giving up their genetic data to population databases so that they can learn more about their ancestry, about their health, or about any other traits they may have an interest in. So when we talk about genetic data, we need to talk about it in that context, which is why in the bill it specifically defines genetic data, and it specifically defines de-identified data. And I have gone making sure to talk to many people about this because in my academic brain, having a master's in genetics, yes, you could argue that any type of DNA is considered genetic data because it's attributable to one person. But we need to remember, this is in the context of direct-to-consumer genetic testing. So genetic data is data that is only attributable to the consumer. The process by which your genetic data would get de-identified is if you would want to participate in research. There are federal laws, there's agreements between different universities, there's a lot of regulations on how that information is used, how it's encrypted, the firewalls and the security measures that go in between that to make sure that there is no data breach. So those are all in place. And in these consent, you need to opt in. You need to say, yes, you may use my data for research, and then it would go down the de-identified path. So I'm happy to talk a little bit more about this, but I would respectfully request a no vote on this amendment because we want to make sure that we are not closing down a specific part of the market for people for which they want to partake. So thank you.
Representative Scott.
Members, I just encourage a green vote. Our genetic specialist here even admitted that it's super hard to de-identify. In fact, you almost can't. It's unique to you. So you can have your genetic data. They can say it's de-identified. It's thrown into this big database. Your name's not associated with it, but it's your DNA and it's your health information. So it would not be hard to find you and pick you out of all of that. So members, I encourage a green vote. Thank you.
All those in favor of the amendment, please say aye. Aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
New Brindley moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A16.
The member from Chisago, Representative New Brindley, to your amendment.
Madam Speaker and members, so the underlying bill includes a provision that creates a pharmaceutical drug or prescription drug affordability board. And while the intent of this is noble, the goal of the board would be to lower the costs of prescription medications, something that all of us agree with, something that we all think is a good idea. The problem, though, is that the solution that we have created with this prescription drug affordability board, it oversimplifies a very complex issue. While we're trying to address the cost of medications, that is good and noble, the prescription drug, the PDAB, the Affordability Board, focuses mainly on provider billing. And the reality is there are lots of different players in this supply chain, and we tried to ask questions about this in committee, but there weren't any real answers. But we've got PBMs, we've got the manufacturers. There are lots of people in this supply chain, but this is narrowly focused. And what I would point out is that in New Hampshire, they implemented a PDAB, and what they have found is that manufacturer prices have indeed been going down. That is a good thing, that is positive. The problem is the overall price to consumers, so to the end user of those medications, has been going up. And I think we want to avoid that. So what the A16 amendment does is it says that when we implement this, we're going to study it. And if we find that the cost of medications has not resulted in this reduction of prescription drug prices, then we're going to repeal the PDAB. We're going to get rid of it if it is not actually solving the problem that we are trying to solve. And members, I would ask for a yes vote on the amendment.
Representative Stephenson.
Thank you, Madam Speaker. Thank you, Representative New Brindley. I certainly agree that we want to be effective here, and I certainly agree that if something isn't working, we should look at a different course. I don't think that this is quite the way to do this. I think that we should take strong action now, and we can continue to have conversations about it in the future. I am confident that this will reduce costs for consumers. I am confident that consumers need this. I think that the Prescription Drug Affordability Board is ideally suited to step between the monopolistic power of big pharmaceutical companies and consumers who need their products to live. And so I would like us to vote down the amendment today, among other reasons. I think by writing in that if prescription drug costs don't go down by some measure, it gives the players in the system an incentive to work against PDAB and actually increase prices to defeat the measure and trigger the repealer. So I don't support the amendment. I'd ask for a no vote.
Discussion. The member from Hennepin, Representative Nadeau.
Thank you, Madam Speaker, and thank you, Representative New Brindley. This is a good amendment. It's not just New Hampshire that has done this, members. It's been done in 7 states, and there's nothing innovative about this approach. This is a piece of model legislation that is trying to get to the heart of the issue of lowering cost to consumers. The problem that has been happening, and honestly across the states, any state that has done it, well, I'll just look at Maryland. Maryland, they set up and there's only 3 of the 7 that have actually attached an upper payment limit to their bills. They're the only 3 states out of the 7 that have combined those 2. So in Maryland, basically, it has to have the approval of the legislature before a change can actually come into place. In Colorado, that board reports to the legislature. They make those recommendations, and then the legislature actually has a decision whether or not it's gonna happen. And in Washington, they've limited it to 12 drugs a year. But let's look at what they all do. They look at list price. So we can basically put a cap on list price, and that's fine. And I'll just use an example of a $400 list price drug. And what's not being taken into account in this bill is the rebates. And the rebates are an important component to driving down cost of drugs to consumers. And let's say that our $400 drug has a 65% rebate, which is pretty common, and leaves a net price of $140. If you've got a copay of 25%, your cost is $100. The plan pays $40. All right, so if this bill also includes the elimination of copays and any kind of cost sharing. So now all of a sudden we're a little bit unbalanced because now we're going to eliminate the copays, cost sharing. We're not taking into account the rebates, which are that's a driving factor in lowering drug costs. And there's actually nothing in the bill where there's a direct nexus between capping a list price and ensuring that a consumer pays a lower cost. So this is a really good amendment. It gives this body 5 years to actually get in there and let's see what they can do. And if they ultimately don't succeed, and I really appreciate Representative Stephenson for bringing it, but if they don't succeed, then let's make some changes. And let's put it in law that we're going to make those changes. So with that, Madam Speaker, thank you. Thank you, Representative New Brindley, for bringing this.
Representative New Brindley.
Thank you, Madam Speaker, and thank you for the discussion. And thank you, Representative Nadeau, particularly for your comments. You are exactly spot on with what has happened in other states. And I just want to address a couple of things before we go to the vote. And first, Madam Speaker, I'd like to request a roll call.
Representative New Brindley requests a roll call. Seeing 15 hands, there will be a roll call. Representative New Brindley.
So I just want to address two things quickly. One, we were told that we are confident that this will reduce the cost to the consumer. The problem is that hasn't happened. This is already happening in other states, and we have direct evidence to the contrary. The opposite has been happening. So I don't know what makes us confident that it's going to be different here. And also this idea that there's this incentive for drug companies to increase prices. Well, the PDAB gets to set the upper limit. Drug prices can't do that because the PDAB is going to set that upper price limit, and they don't get to increase the costs. So these are absolutely false narratives. And frankly, I'm saying let's give it a shot. Let's give this 5 years. Let's see if it reduces the costs, because every single one of us wants that. So let's try this out. Let's see if it reduces costs. But if it doesn't, if this is not saving consumers money, if it is, as it has done in New Hampshire, if it costs consumers more money, then we should eliminate this. And I would ask for a yes vote on the amendment.
Discussion. Any further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 59 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
New Brindley moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A17.
Representative New Brindley, to your amendment.
Thank you, Madam Speaker. And on the A17 amendment, this one is just a little bit different than the A16 amendment. The A16 amendment was addressing cost concerns of this new PDAB. The A17 amendment addresses access concerns. And the A17 amendment would require the state to study what this is going to look like, particularly for access to prescription drugs in Minnesota, and it's going to delay implementation until we have the results of that study. And I want to point to a couple of things. Each of you should have a couple of letters at your desk that I had passed around. One is from a group of different organizations who are interested in ensuring that we retain access. It includes groups like the ALS Association, the Community Liver Alliance, International Cancer Advocacy Network, etc. There are quite a few organizations included in that, and I believe another letter is coming specifically from the ALS Association. So just last year in this body, we passed $20 million funding for research specifically for ALS. One of very, very unique. It was the only funding of its kind across the country. No other state has ever done this to fund ALS. And to be clear, ALS has been significantly underfunded because it is relatively rare, although it's interesting, now that we hear about it a little bit more often, we hear that people have it, right? But it's relatively rare, and therefore it doesn't get the attention that a lot of other illnesses, chronic diseases get. And so it doesn't have a lot of funding. And the concern is that this PDAB, I'm going to run through a couple of concerns, but one is that it will disincentivize pharmaceutical companies from investing in research and development. Let me look through my notes here. That one's on a different issue. The concern is that with these upper payment limits, we are disincentivizing pharmaceutical companies from bringing new medications to market. And as you probably know, certainly at the time my husband was living with ALS, there was literally one medication on the market for ALS, and on average, it increased lifespan a year, maybe. It was relatively minimal. But let me tell you, when you're a 40-year-old guy and you've got kids who are 5, 7, 9, 11, and 13 years old, that 1 year is a big deal. It's a very big deal. And these medications are very expensive. They're very expensive. The flip side of that, not only are these medications expensive, because of that, there are no parameters in the PDAP language for the Prescription Drug Affordability Board. It doesn't give specific parameters on how to make these determinations. And I apologize if I had had this information and language earlier, I would have had an amendment on it. So I'm going to speak to it because it does apply to the A17 underlying amendment. But I was not aware of this, and frankly, it scares me. Again, this is from the ALS Association. I handed this out. I sort of underlined some things that I think are really important in this. But other states are using something called quality adjusted life year or similar metrics. They are literally using metrics that determine the value of someone's life when they determine whether or not a cost is worth it. And of course, there are certainly legal ramifications with this, I think, particularly with the ADA. It is absolutely discriminatory. But I want to say I'm going to read directly from this letter. It says, when applied to healthcare decision-making, the results can mean that people with disabilities and chronic illnesses, including older adults, are deemed not worth the cost to treat. Life expectancy for people with ALS, on average, is 2 to 5 years. My late husband, he lived 3 years, but the last year of his life, he was on a ventilator. So without that ventilator, he probably would have passed away in about 2 years. Fortunately, we were able to get the medical care that he needed when he needed it to extend his life. But this next statement just about kills me. It says, when analysts have applied QALY to a person with ALS, their score reflects a number less than 0, or a state worse than death. That's how bureaucrats have deemed the quality of life for a person living with ALS. Let me tell you about my husband's life with ALS. Even for that last year, while he was on a ventilator, and his care was very expensive, and his medications were very expensive. I mean, I think everyone has heard me say that he was on many different medications, and just one of them, it was actually a nebulizer treatment he took, cost us $600 a month. It's not cheap, I get that. But let me tell you about his life for those 3 years that he lived with ALS, and particularly his last year of life when he was on a ventilator. In fact, I should have passed out some pictures. One of the things he did, we're big board game family, we're big nerds, whatever. And there is an online website where they take traditional board games, but they put them online. And so his best friend is a dentist, and on Aiden's lunch break, almost every day, Aiden would be playing board games with John online. And he would control that. I would put the mouse under his hand. He couldn't move the mouse around, but he had just enough movement in his right hand to click. That's all he could do. He couldn't move it, but he could click. But he could make movement with his eyes on his eye tracking computer. So he could move the mouse around and play the game with his eyes and then click the mouse when he needed to click that mouse. And in fact, at his funeral, Aiden spoke at his funeral, and the website, of course, tracks how many games you have played. And Aiden listed the statistics and all the games that they had played on this website during John's illness. Another thing in our family, we're a big movie family. We set up a theater in our basement, and it's something that we've always really enjoyed. And I've got tons of pictures. My husband wasn't able to access our basement where our movie theater was, and so we would all pile in. We had a room set up on our main level with 2 twin beds, one for my husband and one for me. John, of course, had his hospital bed, and I was next to him in my own twin bed. And we would have 5 kids pile into these 2 twin beds for movie night. And of course, the coveted spot in the room was John's wheelchair, because of course it was a fancy wheelchair that lifted up and down and reclined and did all these things. So that was sort of the coveted spot, was John's wheelchair. My 2 youngest daughters, who were 8 and 10 years old when John passed away, their job was foot massages. My older kids had more serious jobs, frankly. My teenage boys were the ones who helped transfer. They helped with real things. My son, Jack, he actually became an expert in suctioning his lungs out with the ventilator. My daughter, who was just 12 when John passed away, she actually became an expert at that as well. So certainly they were involved in those kinds of things. But my 2 youngest daughters, their job was rubbing Dad's feet. And just about every day, he would get a foot massage from his 2 youngest daughters. I assure you that his life was not a state worse than death. I assure you that that's the case. And I also assure you that while Riluzole, that was the only medication on the market, and there's not much more now, it added an average 6 to 12 months to a life. But again, when your life expectancy is 2 to 3 years, you're 40 years old. My husband was 40 years old when he was diagnosed with ALS. 40 years old. 2 to 5 year life expectancy. That 6 to 12 months is a big deal. It's a really big deal. And even when my husband had no movement, he was effectively paralyzed. Like I said, he could click that little finger. That was about it. We would have to scratch any itches. We would have to turn his head if he wanted to look somewhere. I assure you that his life was not a state worse than death. And I'm really concerned about the implications of a prescription drug affordability board that is going to disincentivize pharmaceutical manufacturers from bringing those drugs to market. And again, I, of course, have very personal experience with ALS, so I've shared that story. But it doesn't just apply to this relatively rare ALS. This is cancer treatments. This is liver treatments. It's all kinds of things that when they first come to market, they're just expensive. They are. And we should consider that. We should ensure, before we move forward with this, we should make dang sure that we are not going to create a situation where we are decreasing access to these really important medications for the people we love and for all of Minnesota. And I would request a roll call, Madam Speaker, and a
Representative
yes
New
vote.
Brindley requests a roll call. Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker.
Discussion. Representative Stephenson.
Well, thank you, Madam Speaker, and thank you, Representative New Brindley. And I'm not, and we often say at the beginning of these little speeches that we make back and forth, thank you. And I really, not that I don't always mean it, but I really mean it in this case. Thank you for bringing that perspective. I appreciate it. I think it's a really important perspective to share with the chamber. And I'm grateful that you're willing to do it. I know that talking about that experience is probably not an easy thing to do. So thank you for that. I do want to assure the chamber that the bill does not include anything like quality adjusted life year, a term that we were just discussing. That's not in the bill. It's not contemplated by the bill. That's not where the bill is going. Frankly, if we had an amendment today to preclude the use of something like quality adjusted life year, I would take it. And I'm willing to work with you, Representative New Brindley, in conference to try and come up with some language to exclude that. That's not the point of the PDAP. And if you look at Section 35, Subdivision 2, it spells out what the Prescription Drug Affordability Board can consider in setting these limits. And none of the things that are listed there are anywhere close to that. It's always focused on price, not is it, worth it or the quality of care, anything like that. It's focused on the affordability, the cost, the price. And again, we can work on incorporating something like that. I think I heard Representative New Brindley say that this had been implemented in other states, and this is a unique Minnesota model of a PDAB. Each state is doing this a little differently. I think ours is the best. I think ours is the strongest, but it is different than other states. And one way, to return to something that Representative New Brindley said on the last amendment, referencing New Hampshire. Ours is very different from New Hampshire's. New Hampshire's only includes state legislators, and they only deal with state and local contracts. So it's much more narrowly focused, and they have yet to issue any price limits in New Hampshire. They've yet to act in New Hampshire, which is perhaps why it's not really fair to say that New Hampshire has increased costs because they haven't actually had a chance to do anything yet. Ours is a specifically Minnesotan model. It does not include the QALY issue, and again, we can work on that in conference. But the reason why I'm going to ask for a no vote on this amendment today was actually the first thing that Representative New Brindley said in describing this amendment. She said, and I wrote it down, that it would delay implementation until there's a study. And members, I don't want to delay implementation. Minnesotans can't wait. Their drugs are bankrupting them now. They're rationing their drugs now. They need relief now. We can't delay implementation, so I will ask for a no vote.
Further discussion. The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. Representative New Brindley, you never cease to amaze me. You are a fighter. We see that from you constantly on the floor. And when you share your stories about your late husband, John, and not lose it, that's just utterly amazing. And what you are fighting for today with your amendment is not only the legacy and memory of your late husband, John, but for all the other Johns. Well, that didn't sound right. All the other Johns out there, I'm sorry, that was not my intended reference on that, but nonetheless, it's out there and it's on the public record. But I think folks know what I mean when I say that. For all the other folks who bump up against the things that you share with us. And you don't do it all the time about your family. And it's got to be terribly difficult to do that. So thank you for opening up yourself and your family and your situation to us. And I encourage a yes, a dark green yes and red vote, or excuse me, green vote on, see, I'm still mixed up in your story here, Representative New Brindley. A solid green vote on the New Brindley amendment. Members, thank you.
The member from Hennepin, Representative Nadeau.
Thank you, Madam Speaker. I couldn't tell a story like that, so thank you. This is another good amendment, members. Getting this right has consequences. And we always know there's negative consequences to when government sets prices. And we have already an example. You know, the feds, through the Inflation Reduction Act, have basically said, they've gone out there and they've adopted this, and it's started to set price controls. University of Chicago economists, not this side of the aisle, you know, economists. They've basically come out and they said that everyone agrees that price controls will decrease the number of new drugs. The debate is about how many. They estimate that just the Inflation Reduction Act is going to reduce research and development spending by up to 60% from 2021 to 2039, resulting in up to 342 fewer new drugs. So this is not just some simple thing about, you know, one person's story. This has consequences. And I just don't think we should move into it this quickly. I think this is, you know, Representative New Brindley's amendment is spot on, members. So please vote green. Thank you.
Representative New Brindley.
Thank you, Madam Speaker. And Chair Stephenson, thank you for that. And I hope that even if you choose not to take this amendment today, I hope maybe we can consider in conference explicitly excluding such metrics to ensure that those things don't happen here in Minnesota. But I want to say, even this idea that the board is focused on price, that's exactly the problem. And Representative Nadeau just pointed out exactly what the problem is when we focus on price. When we are determining the upper payment limit for these pharmaceutical companies, they're not doing the R&D. They're not bringing the medications to market. And again, that was a University of Chicago economist. It's not exactly a conservative think tank. That is the problem. And the problem is then that we are going to see fewer and fewer medications come to market for the most rare illnesses that are affecting Minnesotans. There are other diseases for which there's lots of funding, frankly. There's lots of resources poured into them. But we've actually had a lot of discussions in this chamber about rare diseases. We've got a rare disease council. We care about that. And as legislators, we care about that because it is very easy for people with rare diseases to become the forgotten people. It is very easy to deem the rare disease people less important than the people who are affected by things that, frankly, we see often and there are lots of resources for. Like, there's a reason that we care about these things, and we need to care about it here. I do believe the answer is, and I would suggest that there are other states that are doing this. It is worth delaying. It is worth understanding what happens in those states before we make the mistake here. And I would just add this information that I offered about New Hampshire, about the manufacturer's prices coming down, but the cost to consumers going up. Again, that is not information from a conservative think tank. That is from their PDAB chairman, Gary Merchant. He is the chairman of the Prescription Drug Affordability Board. He is the chairman of the board in New Hampshire. He is the one who is telling us that manufacturer costs are coming down, prices are coming down, but costs to consumers are going up. And we have to understand that. Let's not make a mistake with this. It is too important. Please vote yes on the amendment.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 59 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Doubt moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A14.
The member from Isanti, Representative Doubt.
Thank you, Madam Speaker and members. This is an important amendment that will address or continue to provide stability in our individual insurance marketplace. Obviously, you probably remember in the past, this has been an issue with the instability in the individual insurance marketplace caused by the ACA and its implementation here in the state of Minnesota. Rates skyrocketed, people left the marketplace, some people went without insurance. Right now we're in a very stable place where the individual insurance marketplace has provided real reductions of at least 36% in premiums to folks that are purchasing their insurance there, and it is funded now based on the actions of the last legislature, and I think there's enough money in it to fund it likely for a full 5 years. The underlying bill, and I'm not necessarily the fault of the bill author, but he received a target for a negative, I forget the number, $236 million or something like that, which means, in budgeting speak here at the legislature, it means that he was told to take that money from the reinsurance program, from the premium insurance fund or whatever it's called, and take that out and transfer it back to the general fund to use for other things in the budget process. That provides instability for those people that are in that marketplace, and essentially it will end that insurance 2 years, at least 2 years early for the folks that are in that insurance marketplace, which will directly increase rates for those people at least 36% and maybe more. So this amendment calls for a study to study the benefits of that reinsurance program, which has become a model for other states across the country that have implemented it successfully. I think there's probably, is the number 13 or 14 other states, something like that, that have done this and done it successfully, and it's been a successful model. We kind of led the way here in Minnesota. So I think it's something we should be proud of, and we should leave that money there to provide that stability. So I would ask for members to support. This amendment does two things. It says that we'll do the study, and then based on the results of that study, it will delay the transfer out of that premium insurance account or premium security account to the general fund, which will leave the money there for those people to use if the study shows that it's warranted. So I would ask for your support on the amendment.
There is an amendment to the amendment. The clerk will report the amendment.
Stephenson moves to amend the doubt amendment to Senate File Number 2744, the unofficial engrossment as amended. The amendment to the amendment is coded A18.
Representative Stephenson.
Thank you, Madam Speaker, and thank you, Representative Doubt. As Representative Doubt just said, there's two components to this, a study and then a delay or cancellation of a transfer. We can't do the delay in the transfer. That would throw the bill out of balance and make us in violation of the target, but I am thinking the study is a good idea. So what this amendment does is it eliminates the second part of the bill, the effective date portion, but keeps the study. It would be my intention that once we adopt this amendment, that I would recommend a yes vote on the underlying amendment.
Representative Doubt.
Thank you, Madam Speaker and members. I would ask members to vote against this. And just so you know what you're doing, voting for this will transfer the money out of that premium security account. It will end the reinsurance program effectively, throwing those people into instability and raising their rates by 36%. So that's what this vote means, and I'd request a roll call vote.
Representative Doubt requests a roll call. Seeing 15 hands, there will be a roll call. Further discussion on the Stephenson amendment to the Doubt amendment. Seeing none, all those in, the clerk will take the roll on the amendment. We are voting on the Stephenson amendment to the Doubt amendment. The clerk will close the roll. There being 69 ayes and 59 nays, the motion prevails. The amendment to the amendment is adopted. We are now on the underlying Doubt amendment. Representative Stephenson.
Thank you, Madam Speaker. I ask members to vote yes on the amendment.
Representative Doubt.
Members, thank you and appreciate that support of this half of the amendment, Representative or Chair. This study is important. It will undoubtedly show the benefit to Minnesotans and the stability that this has brought to the individual marketplace, and it will undoubtedly show that this has been a successful program and that we should continue to fund this program to keep these rates stable. So I would ask for member support, and a roll call is not needed with the both sides agreeing to it. Thank you.
All those in favor of the Doubt amendment as amended, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
O'Driscoll moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A3.
The member from Stearns, Representative O'Driscoll, to your amendment.
Thank you, Madam Speaker and members. The A3 amendment deals with a provision that is in this bill that directly affects anyone who owns a home or anyone who rents property from a housing provider. And the provision is having to do with the kind of insurance that you would have. That's called liability insurance. And liability insurance is when someone comes to your place, your home, whether you rent that property or whether you own that property, and they become injured. And it protects you, the homeowner, or you, the tenant, when you invite guests and others that come to your property. And insurance companies take great care as they go through and do evaluation of risk. And one of the things that has been a staple since the beginning of time is risk management. And one of the areas that the insurance companies attempt to manage risk, keep your premiums, my premiums on homeowners insurance lower, or renters insurance, is vicious animals. And what they do is they collect data and information on animals, and they find out, are you more likely to be bitten by a goldfish than a dog? Are you more likely to be scratched by a cat or a coyote? Are you more likely to have a timber wolf as a pet? And if so, what are the consequences of that? And as you start looking at the different types of pets, you get into some aggressive breeds of dogs. And folks like to have those breeds of dogs, but the problem is, because of the vicious nature of these dogs, the likelihood of a loss or a claim, a liability claim being paid, goes up. So the grandma who has the lap dog, the little poodle at her apartment to keep her, with some company and things, might be at a nursing home, might be at one of the facilities that we have and have talked about, nursing homes and assisted living facilities. The likelihood that that animal is going to be vicious is pretty slim. But that grandma would end up paying more in renter's insurance or homeowner's insurance because someone had one of these vicious animals. The provision in the bill says, insurance companies, you can't rate accordingly on that. Let me say that again. Everybody who owns a home and has a pet is going to have to pay more for insurance premiums because we can't go ahead and actuarially account for the losses that are associated with these vicious animals. Since we started this session, there have been 2 instances that have occurred here in the state of Minnesota involving pit bulls. This is one of those aggressive breeds that I'm talking about. There was a 82-year-old person who lived up in Brooklyn Center who was mauled to death by 4 pit bulls. 82-year-old person mauled to death by pit bulls, an aggressive animal. Recently, there was a 21-year-old who was taking care of his brother's pit bulls, and those pit bulls turned on the 21-year-old. The disposition of these animals is unpredictable. Quite honestly, I don't care if you own those animals. Just don't ask everybody else to pay for the liability insurance for you to have those animals. Just like people who have traffic violations tend to pay more for insurance than those who don't have traffic violations because of the thing called risk. So, ladies and gentlemen, members, I would like a roll call vote on this.
Representative O'Driscoll requests a roll call. Seeing 15 hands, there will be a roll call. Representative O'Driscoll.
And strongly encourage a green vote. Thank you, Madam Chair.
Discussion on the O'Driscoll amendment. Representative Ryer.
Thank you, Madam Speaker. Thank you, Representative O'Driscoll. Before I talk about some of the statements from Representative O'Driscoll's comments, I'd like to just talk about why it's important that we do pursue the removal of dog breed as a barrier to insurance. It harms consumers first and foremost. It is a barrier to people who are uninformed. They buy their homeowners insurance, homeowners only. This does not cover rental insurance. They buy it and aren't aware that they may end up underinsured because they simply don't know the fine print of the dog breed restriction. And then, to me, more importantly, is the fact that this has been associated with racial disparities and structural inequities in the housing market. The banning of breeds is aligned with the old practice of redlining. It's a modern form of that. And it's not something that we can continue to allow. It goes against our values as a community and as a society. Now, in Minnesota, we don't allow this at the municipal level, but we need to clean up our statutes to make sure there's no holdover from this era. Next, the use of breed lists is not backed up by actuarial science. There's no reliable actuarial data that supports making a distinction between breeds. In the bill language, there's an exception for dog breed restrictions that are based on sound underwriting and demonstrated actuarial principles, should those be put in place. We also have exceptions in the bill for dogs that are considered dangerous or potentially dangerous as defined by existing statute. We are just requiring insurance companies to focus more on the individual dog and their past behavior than on a breed. I mean, there's no doubt that when we have incidences like the one recently, or the two recently in Minnesota, that these are tragic. And I think everyone's heart in this room goes out to the family and all the people involved. But we do need to use evidence and data and patterns to craft and frame sound legislation that supports everyone in our communities. Now, there are a lot of organizations that have positions on breed-specific language. The American Bar Association, the U.S. Postal Service, who focuses more on prevention than breed discrimination. The language in this bill was agreed to by the Insurance Federation. State Farm does not use breed-specific barriers. So I would argue that there are many good reasons to vote no on this amendment. Thank you.
Discussion. Representative O'Driscoll.
Thank you, Madam Speaker and members. I would tell you that my experience in the insurance industry and my work over the years on these matters tell me something quite different than what we just heard. I will tell you that, as I said in committee, the interesting part about dogs is they only bite once. Did you know that? Now, those in the committee know that because I shared this story with them. Dogs only bite once, where the insurance company pays, because as soon as your dog bites, they cancel you. And as a part of the risk management process, when you sit down with an agent, the agent will run through a list of questions with you. How much personal property do you have? Do you have jewelry? Do you have? And then they'll get into what kind of animals do you have? Do you have exotic animals? And they use that to underwrite you, to determine what your premiums are going to be. Members, a yes vote on this amendment to strip this language out is a way to keep homeowners and renters insurance in the state of Minnesota, because it is not a mandatory coverage. Auto insurance is. When you buy auto insurance, when you buy a vehicle, you must carry auto insurance in order to drive down the road. When you buy a home, you are not required to have homeowners insurance. Your lender may require you to have it. You can't get a loan. Your landlord or your housing provider may require that you have renter's insurance, but the law doesn't. So as insurance companies, risk goes up and they're unable to account for that. Companies will file to leave the state of Minnesota, leaving fewer options and higher premiums. And I can almost hear it in the minds of some people in this chamber going, there goes another Republican trying to scare people about what's going to happen in insurance. All we have to do is look back to what happened to health insurance in the state of Minnesota. We went to the ACA. When the rules changed, it's a math problem. And the math has to work out or you have a bigger problem. Members, a green vote moves to preserve premiums for everyone. A red vote moves us toward higher premiums and the removal of insurance options here in the state of Minnesota. Thank you, Madam Speaker.
Any further discussion on the O'Driscoll amendment? Seeing none, the clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. There being 57 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Doubt moves to amend Senate File Number 2744, the unofficial engrossment as amended. The amendment is coded A13.
Representative Doubt, to your amendment.
Thank you, Madam Speaker and members. Excuse me. This A13, is that right? Yeah, A13 amendment deletes out a section of the bill called the in the bill called the Family Protection Act. We have referred to it around the legislature for quite a few years as the boat bill. And this is something that just unfortunately the language in the bill just doesn't work. You know, I actually was a supporter of this provision when it first came out, and because the stories are kind of heart-wrenching, right? And you see that and you think, boy, somebody should be able to be compensated for that. But when you talk to folks about it and you think about the actual details of the actual legislation, you realize the large amount of problems that there are with this language. So what the language in the bill would do is it would allow a family member, so if you've got a boat and you have insurance, liability insurance on that boat, you are driving the boat and one of your family members is injured in that boat, it allows them to sue you to get access to that liability insurance coverage, which really creates some problems. Basically what you end up with is you end up with one spouse suing another or children suing a parent, and I'll walk through why and what some of the problems are with that. Number one, the problem is you've got mandated insurance coverage on insurance that is not mandated in the state of Minnesota, and that's what makes this different than automobile insurance. We do not mandate boat coverage in the state of Minnesota. And actually, I think under this bill, you would actually see less insured boaters in the state of Minnesota, which would provide more liability for someone who is injured with no insurance policy to go after. It really leaves Minnesotans in a tough situation, and I don't think we want to create that scenario in the state. So what this bill does is it creates a moral hazard. It creates an incentive for one party to sue another when there is a shared financial future between those two parties. And you know, liability insurance really requires somewhat of an adversarial relationship between two parties. When you have two parties related to each other who share a financial future, if the insurance company is representing me and defending me, and my spouse, who I share a financial future with, is suing me, there's a great incentive for me to participate with my spouse and start testifying kind of in a way that's against the insurance company, which would create insurance fraud and a very high potential for insurance fraud in the state. So there's a reason that this isn't done anywhere. No other state does this. There's a reason that this isn't done in the insurance industry at all. It really creates a high potential for fraud, and frankly, we don't want that in the state. I do know that the bill author understands that there are some problems with this bill. After it left the Commerce Committee, which is where I heard the bill, in Ways and Means Committee, there was a provision added to this that says, basically puts a cap on any premium increases that can't exceed 15%. And there's a problem with that. First of all, there's an admission there that they know that this is going to create opportunities for a spouse to sue another spouse. It's going to create an opportunity for insurance fraud, where the two parties are kind of now working against the insurance company, and they both would benefit financially from that relationship. But what will happen is, because insurance coverage is not mandated in the state of Minnesota, if insurance companies are told that you cannot increase your premiums beyond 15%, but yet because of this bill, they have losses that exceed their ability for this insurance product to be profitable, they will stop offering insurance in the state of Minnesota. So we're basically telling insurance companies that we'd rather not have you offer insurance in the state of Minnesota, you know, and rather than allow you to recoup your costs to provide that insurance coverage. So, and having no insurance coverage in the state is very problematic. Again, we do not mandate boat coverage in the state. There is so if we have insurers that are leaving the marketplace and not offering boat insurance, in the land of 10,000 lakes, which actually I think we have more than 15,000 lakes in the state of Minnesota. This is the fabric of our summers here in the state of Minnesota. I mean, I don't have statistics in front of me on boat ownership and how many Minnesotans enjoy boat ownership and participate in that. But there is a place where if you're getting a loan when you're buying a new boat, the bank would require you to have insurance. And if we have an access problem to insurance and you can't buy insurance on a boat in the state of Minnesota because of this inability for an insurance company to recoup its costs or cover its losses because of this new provision, what we're going to end up with is nobody's going to be buying boats. And we have dozens of boat manufacturers and dozens of boat dealers in the state of Minnesota who are going to suffer a real economic consequence because people aren't going to be able to buy, actually they're not going to be able to even buy boats because they won't be able to buy insurance for their boat. And not to mention the fact that if this thing goes into place and insurance rates do go up, or if there's less insurance products available, it likely means we'll have less insured boats because the only people required to have boat insurance on their boat are people that would be required by their lender. It means we'll have less insured boats on our lakes, which actually puts Minnesotans at risk, at a greater risk, if they are injured in an incident and they may not be able to recoup from that liability policy to cover their losses or their injuries in the event that there is an unforeseen accident. So this bill actually, I think, puts Minnesotans at greater risk. And just this language just does not work. And I know that the bill author is continuing to talk to folks from the insurance industry to try to find language that works, and I'm hoping we can get there. If this language does stay in this bill and goes into conference committee, I'm hoping, and I will offer to continue to work with the chair to find language that will work. And because certainly I think we want to make sure that people are safe in their boats. And while we all know that boating accidents aren't common in the state, when they do happen, there can be serious injury and death. There is no question about that. So we just want to make sure that we don't set up a situation where we do have a potential or even an incentive for fraud against insurance companies and skyrocketing insurance rates and lack of availability of insurance in the marketplace, because ultimately we want Minnesotans to enjoy our lakes, we want them to enjoy our summers, we want them to be safe, and we want them to be protected. So with that, Madam Speaker, I'd request that members vote in favor of this, and I would request a roll call vote.
Representative Dow requests a roll call. Are there 15 hands? Seeing 15 hands, there will be a roll call. Representative Stephenson.
Thank you, Madam Speaker. Thank you, Representative Dowd. And just for your curiosity, I got a text here. I can't totally vouch for the accuracy of this, but I'm told there are 830,073 registered boats in Minnesota, of which, if it's still true, I recall on the floor in 2019, former Representative Jerry Hertas said he owned 13 of them. So there are, you do the math there, less 13, that's everyone else's boats, and then Hertas has 13 of them. Members, the reason why you buy insurance is to protect the things that you care about. And what do we care about more than our own families? If you are buying boat insurance, you are going to presume, understandably, naturally, that this protects your family. And you would have every right to assume that, because the most frequent interaction, the most analogous interaction that you'd have with insurance industry is an auto insurance, which, as Representative Dowd said, is mandated and boat insurance isn't. But it's important to understand that in auto insurance, we don't allow family exclusions. So consumers who buy boat insurance have every right and understanding to believe that their family members are covered. And then tragedy happens and they find out that they're not. That's what this provision is about. I do want to speak briefly to the moral hazard aspect of this that comes up, and the idea that this is going to promote insurance fraud, which I don't agree with. And I'll just note, and I've said this many times before, but this idea as a solution to insurance fraud is, and I saw Representative Niska stand up just a second ago, so he'll appreciate this, is under-inclusive and over-inclusive as a solution. Right? That's a lawyerly phrase. Over-inclusive and under-inclusive. What do I mean? I mean that it doesn't actually, It prohibits claims that are not fraudulent, and it doesn't prohibit claims that are fraudulent. Okay, so if I was going to commit insurance fraud, if I was going to commit insurance fraud, I would not do it with my wife. She would not be a willing participant in that scheme. She would sooner divorce me, and she would turn me in if she had knowledge. So very bad choice for me to try and commit insurance fraud with my wife. But my best friend, he would be totally up for it as long as I gave him a good share of the profits. Like he would be up for that, 100%. A family exclusion wouldn't stop me from committing insurance fraud with my best friend. It would with my wife, but again, divorce is a better remedy there. But for my best friend, you know what will stop me from committing insurance fraud? Prison. Because insurance fraud is illegal. That is the protection we have there. And it's a much better protection than a family exclusion. Members vote no.
Discussion on the doubt amendment. Representative Niska.
Thank you, Madam Speaker and members. And Representative Stephenson or Chair Stephenson, I think you should maybe talk to O.J. Simpson's book agent. Maybe you have a sequel to his If I Did It book there. But members, I think it's very important that we're very clear about the types of insurance we're talking about here. We're not talking about medical insurance. We're not talking about no-fault insurance like the auto insurance we have here. We are talking about liability insurance. And so, yes, I think it is important that all Minnesotans understand that when you buy liability insurance, what you're buying is protection from your own liability. That when you are liable to somebody else, that you are buying protection for that liability. The way that insurance is accessed is by essentially litigation, either threatening a claim or actually filing a claim. And those coverage issues are going to have to be resolved by trying to figure out disputed facts. A boat accident happens. Who knows exactly what happened other than the people who were there? And then maybe looking at some physical evidence that came after the fact. And so the real concern here isn't necessarily all of the out-and-out insurance fraud, although I think there is a potential for that. Representative Dowd makes good points about that. The problem is that the way that we resolve in our legal system disputed questions of fact is to have an adversarial process where different witnesses will testify about what they knew, and then we figure out what the answer is, or hopefully we're able to resolve that short of having a jury decide what the answer is. So the problem with this, and the reason Representative Dowd is completely correct that this kind of insurance really doesn't work in the liability insurance context, is that you don't really have an adversarial system when the parties on both sides of the V, so to speak, the plaintiff and the defendant, have a common interest. And the one who has the opposing interest, the insurance company, and frankly, all of the other policyholders who are paying into that insurance pool, they're kind of left on the wayside. And so I just wanted to add that perspective. I think Representative Dowd is completely correct that this is not a model of insurance that works in the liability insurance context. And we're talking about boat liability insurance. Having this type of claim that's recognized in the liability insurance context is going to really distort the adversarial process. It's going to distort the insurance markets, and Representative Dowd is absolutely correct. It is going to make boat insurance harder to get and more rare in our Minnesota lakes. Representative Dowd's amendment is a good amendment. Vote yes.
Further discussion. Representative Dowd.
Madam Speaker, and thank you to the chair and to Representative Niska for your comments. Just to wrap up on this particular amendment, I appreciate the input on the amendment. I'm told, and it doesn't surprise me, the 870,000 boats in the state of Minnesota. I'm told by folks that only 70% of boats right now are insured, and I think if we saw rates either increase or access to insurance decrease, I think you would see that number decrease. And I think what we want to do here in the legislature is try to promote more insurance on those boats and not less. Because if a boating accident does happen where somebody is at fault and it's too adversarial is a legal term. I don't mean adversarial, but two people who don't know each other in two separate boats, and one breaks the law and does something to injure somebody in the other boat, there should be coverage and there should be liability coverage that the person who is injured by no fault of their own has access to. The problem that we create here in the scenario that the chair mentioned, he mentioned his friend. Interestingly enough, he does not have a shared financial future with his friend. He does have a shared financial future with his wife. So if his wife is suing him, and I'm not suggesting that people are going to seek out or cause a boating accident in order to create fraud. What I'm suggesting is that a boating accident happens, one of your family members is injured on your boat, and now you're looking around saying, hey, somebody's lost a limb, why can't we get reimbursed for this or compensated for this on our liability policy on our insurance coverage? And so Minnesota law would require that the wife in this hypothetical scenario sues the husband and his insurance company. He was driving the boat when the accident happened. And now you've got those two in depositions and in court where these two people and the insurance company's star witness and the person who they're defending now has a shared financial future with the person who is suing him. And now that insurance company's witness might change their story a little bit to say, well, gosh, we didn't plan this accident. It wasn't insurance fraud in the sense that we intended to, lose a limb in a boating accident and, in exchange for some big payday, but it happened. And now, boy, if I just change my testimony a little bit, my wife could get $1 million paycheck from my liability insurance company or whatever number. And because we have a shared financial future, I will benefit from that. And that's where the insurance fraud comes in. And that's why this isn't done in any other state. It shouldn't be done here. It doesn't work. And frankly, I think we're setting up a scenario, number one, where we're encouraging people to commit insurance fraud. Number two, we're increasing rates of boat insurance. And number three, we're potentially affecting or impacting access to boat insurance, which will reduce the number of insured boats on our lakes, which puts Minnesotans at risk. And for all of those three reasons, I ask you to vote against this, or for this amendment and against this provision in the underlying bill. So please vote green.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 58 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Senate File 2744, third reading as amended.
Third reading as amended. Discussion on the bill. The member from Anoka, Representative Niska.
Thank you, Madam Speaker and members, and thank you to the other members of the Commerce Committee. It was fun to serve on this committee. Thanks, Chair Stephenson, Vice Chair Katiza-Watun, and Lead O'Driscoll, and our awesome staff, and all the other members who indulged my, kind of odd questions at times. I came onto the Commerce Committee as a first-year member. I thought that the point of the Commerce Committee was, to have some common sense consumer protection, but balancing that with the regulatory environment that we need to have a vibrant economy, especially in a tough time here in Minnesota. Instead, what I think we're seeing from this commerce bill is a bill that punishes pretty much every industry in Minnesota, other than, and I guess as a lawyer, I'm a little grateful for this personally, but it really punishes every industry in Minnesota other than the legal industry. It's really a pro-legal sector bill and an anti pretty much every other sector bill. It's a bill that's chock full of litigation traps for Minnesota businesses, new private rights of action, new attorney general enforcement mechanisms, and I think this one wins the gold medal for unconstitutional provisions that will be challenged in court. Starting with the private rights of action, just a couple of examples. We have a new private right of action for increased price increases in generic drugs for consumer short-term loans. Again, these are going to be great for trial lawyers. I'm not sure they're going to be all that good for much of anyone else. But the worst provision in this bill on this front is a new free-floating provision that prohibits and creates new private cause of action and Attorney General enforcement for, quote, unfair and unconscionable acts and practices. And this is addressed in a couple of different places in this bill, but on page 173, lines 13 through 17, you can see that it creates a new cause of action for, quote, any method of competition, act, or practice that, 1, offends public policy as established by the statutes, rules, or common law of Minnesota, 2, is unethical, oppressive, or unscrupulous, or 3, is substantially injurious to consumers. Now, if you're hoping that we define what any of those terms mean in the bill, you'll be disappointed. Instead, we're just creating vague, brand new, unnecessary legal traps and potentials for frivolous lawsuits where lawyers and then courts, potentially the Attorney General, decide what offends public policy or what is, quote, unethical, oppressive, or unscrupulous, or substantially injurious. Now, what we heard from the Attorney General's office, obviously they want more authority, but what we heard from the Attorney General's office is don't worry about those vague words because other states' legislatures have also passed really vague words, really, really broad words, and their courts have stepped in and limited them to something more reasonable. Well, I hope that's what Minnesota courts do if we pass this legislation, but that's not what we should be doing when we're legislating. We should be the ones defining what is unethical, oppressive, or unscrupulous, or what is substantially injurious to consumers, and we do that in a lot of other places in our statutes. If there are holes in those, we as the legislature should fix those holes. We shouldn't delegate our authority to the Attorney General, to private lawyers, and ultimately the courts. It also creates a number of provisions, a lot of work for the Attorney General's office. Again, the Attorney General gets to enforce that unfair and unconscionable acts and practices law. They get to enforce excessive price increases to generic drugs, the Digital Fair Repair Act, the automatic auto-dialing announcing devices statute, and the age-appropriate design code, among others. But third, I think that the way that this really hurts Minnesotans and helps the legal industry is it creates a bunch of new work for lawyers who are going to challenge this bill as unconstitutional and creates a bunch of new work for the Attorney General's office to defend unconstitutional provisions. And I've talked about this, and I can't even remember how many bills that have come to the floor where I just continue to say the same thing. This is going to be challenged in federal court. Look at the case law. It's probably going to get struck down. And we rush ahead anyway. Like I said, though, this one probably wins the gold medal on that front because there are at least 3 provisions that I think are likely to get struck down on constitutional challenges. The first is the generic drug price controls on pages 34 and 35, a prohibition where we, as the state of Minnesota, are clearly reaching out into transactions happening between a drug manufacturer and a drug wholesaler that outside of the state of Minnesota. It's very clear from the language of the prohibition, the language of the exception, that this prohibition only applies to drug sales happening outside of the state of Minnesota. The Fourth Circuit Court of Appeals struck down an almost identical Maryland law on grounds, the core legal grounds that apply directly to the language in this bill, and Minnesota has had similar problems. For example, recent regulation of gold bullion, something that I was told there's some inside joke about the debate that happened on the House floor. That was before my time. In that federal constitutional claim, though, Maryland had to pay the attorney's fees for the drug industry, and I fear that Minnesota is going to have to do the same. So vote for this bill if you want money taken from our state treasury to pay the generic drug manufacturers to sue and win the lawsuit against the state of Minnesota. I don't want to do that. I don't think that's a good use of our taxpayer dollars, so I'm voting no. The Digital Fair Repair language has a retroactivity provision that applies to equipment sold on or before July 1st, 2017. If you think that's a little odd and maybe applies retroactively to contracts that have already happened in the past, you're right. And that, unfortunately, is also probably going to be challenged on at least 3 constitutional grounds. There's a federal impairment of contracts clause. federal due process clause and an ex post facto clause, and there are Minnesota constitutional provisions as well. Again, we're likely to get sued and probably lose. Third, the age-appropriate design code. Representative Stephenson referred to this, or Chair Stephenson referred to this as a new Minnesota model legislation. It's actually legislation that was passed first in California, and it's currently being sued and challenged on First Amendment grounds in California. But as I looked into this and researched it, I realized it's not actually even a California model. It's based on a model by an organization known as Five Rights that promoted it. And as we're looking into this question and the constitutionality of it, I was wondering if Representative Bonner would yield for a question.
Representative Bonner will yield. Representative Niska.
Thank you, Madam Speaker, and Representative Bonner. I was wondering if you could help us, just to be on the same page, help us to understand where is Five Rights based and who was it started by?
Representative Bonner.
Five Rights is an organization started in the UK. You may be aware that the age-appropriate design code is actually live in the UK right now. It is already been implemented and is being used successfully there. Five Rights is an organization that has been looking to help bring better online and technical safety across the country. They do excellent work. And I want to be very clear to members on the floor today that the age-appropriate design code is about protecting our children online. Every single member in this chamber has probably heard from parents in their district that they are desperately looking for tools in order to keep their kids safe online. As a result of this legislation, what we've seen, Representative Niska, is that we've had large tech organizations who have already started making changes. TikTok announced that they would no longer allow strangers to send text messages to underage children. They've always had the ability to do that. But not until today, not until the threat of actually having to consider consumer protections for children, did they start to move that direction. YouTube decided that it might be best not to have addictive features anymore that allow children to do a continuous watching of various videos and suck them into that addictive behavior. We have folks who have decided that they will no longer be sending out ping notifications to children late in the evening. These are all positive changes that have actually started to occur already. And I'm really glad that you mentioned the First Amendment issue, because if you knew that, Representative Niska, then you obviously also know that that has been addressed in my version of the bill. I assume you read it and you know that there is nothing about this bill that pertains to content. First Amendment issues are based on content. This bill is a design bill. It's about asking companies to use a very common tool. I'm so glad, by the way, Representative Niska, you gave me the opportunity to talk about this bill. I really want to thank you for that, because this is such an amazing, amazing bill. And do you want to know why it's the best bill out there? Do you want to know why big tech is so afraid of this bill? Because it is literally the best bill out there. It is the smartest, it is the most targeted bill. And the reason it does that, Representative Niska, is it starts in the design phase, before the harm to your children can be done. As an IT professional, you probably also might know that I have over 20 plus years in IT experience, and I work specifically with software companies who develop online products and applications. That's literally what I do. So the brilliance of this bill is that it goes into the design phase and it says, let's take a look. We're going to ask companies to use a common tool that is used in marketplaces and in businesses everywhere across this country. It's called a risk assessment. It's not new. It's not novel. It says that we do this every day in other concerns. But it says that we want you to do this risk assessment and we want you to think about children first. not after the harm is done, not later. We want you to think about children first. And by the way, every industry in this country already does that. Whether it's car seats, whether it's cribs, or whether it's vehicles. Anywhere we know that children are likely to be in this country, we take protections. We take measures to make sure that children are safe. The internet has been given a pass. Technology has been given a pass for decades on this. Why should technology not have to follow the best interest of children? I ask you that, Niska, and I would ask you back, Representative Niska, since you seem so concerned about rights, what about the data and privacy rights of children? Children under the age of 18. Do you know that these companies are actively targeting our children? They are collecting data on our children. They're using it to target them. They know the location of our children. They know where they live and work. Right? This is all wonderful. So, do we really want to have large tech surveilling our children? Do we want them to use that to target advertising to our children? Do we want them selling the data on our children? I'm pretty sure, Representative Niska, that if you went back and talked to the folks in your district, you will find that your parents are begging for some way in which to better address the issues for their children online to keep them safe. We wouldn't allow our children to talk to strangers in public. We shouldn't be allowing them to do things like that online either. This bill is about protecting the data and privacy of children. I have every confidence that this bill is the best of breed for that reason, because it does it in the right place. Not only does this bill do it in the right place, Representative Niska, but it also, as you do that risk assessment, it asks you to make certain mitigations that are appropriate to the level of risk. It also provides a 90-day right to cure, which means that businesses also have the opportunity to correct their mistakes, to do the right thing. It is the best approach for business. It is the best approach for Minnesota children. It is the best approach, period.
Representative Niska.
Thank you, Representative Bonner, for that lengthy speech. I thought I was listening to the last president there talk about how everything he did was the best. But you're absolutely right that I hear from parents in my district. In fact, sometimes when I talk to myself, I'm hearing from parents in my district who are concerned about this problem. I am very concerned about this problem. That's why I signed on to a bill Representative Robbins dealt with, introduced dealing with this. I'm not sure it's the perfect solution either, but I'm absolutely concerned about this. I have children from 17 to 11, 3 children who I am very much concerned about. But members, it was, I think, maybe 20 minutes ago when Representative Bonner actually answered the question that I asked. So let me remind you of what the answer to the question was, which is that this bill is actually model legislation from a UK nonprofit organization. She didn't actually say who started it, so I'll help her out with that. It's actually a British noble. So I'm absolutely concerned about this bill, or about this problem, Representative Bonner, but I don't think the right answer to this problem is by looking to a country that doesn't have a First Amendment. And you're right, it's already in force in the UK, but the UK doesn't have a First Amendment. They don't protect First Amendment rights. So we shouldn't do a British model. We shouldn't do the German model. We shouldn't do some other model. We should do the American. We should deal with this problem with an American model in the American way. And it is absolutely, your bill absolutely does deal with content regulation. There's no way to be age appropriate without dealing with content regulation. So we do have to make sure that we are very careful in how we deal with this problem in a way that is the American way, that protects our First Amendment rights, that protects all of our rights to free speech. This bill fails to do that, and frankly, this age-appropriate design code, and frankly, this overall bill fails to help with the economic problems that we have in this state. Our legal sector isn't the sector that needs a stimulus. Consumer protection certainly should be a priority, but the rest of our economy needs a balanced business environment to thrive. This bill misses the mark. It mostly creates more jobs for lawyers and invites other constitutional challenges. I love lawyers. I think lawyers are important, but lawyers aren't who needs, the legal sector isn't who needs a boost right now. It's the rest of the economy that needs a boost. This bill misses the mark. Vote no.
The member from Chisago, Representative New Brindley.
Madam Speaker and members, I'm just going to touch on a few items in this Commerce bill that's before us this morning. And I'm wondering to start, is Representative Cagle on the floor? Would she yield for a question?
She will yield. Representative New Brindley.
Thank you, Madam Speaker. I just want to make sure I understand some of the changes to the bill. I certainly continue to have concerns about completely eliminating payday loans in Article 3, Section 6. But it looks like there have been changes made, and so you're preserving access to loans where that principal amount of the loan is over $1,300 without a minimum payment or credit advance. Am I understanding that correctly?
Representative Cagle.
Thank you, Madam Speaker, and thank you, Representative New, for the question. Yes, enabling access to safe and helpful credit options for subprime consumers is in Minnesota is a significant concern of mine, and which is why we've eliminated predatory payday lending loans, but also provided funding for nonprofits to attempt to fill at least some of that gap. That may be left when payday loans are stopped. And so that's the reason, as you point out, that why we have the limited provisions in Section 6 codified in statutes in 47.601. So we just want to make sure that consumers have choices and options available that are not predatory. So thank you.
Representative New Brindley.
Thank you, Madam Speaker. Would Representative Cagle continue to yield?
She will. Representative New Brindley.
Thank you, Madam Speaker. I just want to be very clear. So you are preserving, maybe even just a head nod would do the job. You are preserving those loans where the principal amount is over $1,300 if it doesn't have a minimum payment or credit advance? Yes, okay, excellent. I just wanted to make sure I understood that correctly. So certainly, I appreciate that, and I appreciate that change. I still certainly have some concerns over the issue of removing options that, frankly, sometimes folks need. And while there are some alternatives in place, we could be putting people in a bad position who frankly, need access to their own money. It's their own money to pay their bills or whatever. So I do have some concerns about that. But quickly, I'd like to address some of the things that Representative Niska was hitting on with the age-appropriate design code. This is something that I am deeply concerned about. I am also a co-author on the Representative Robbins bill that was sort of getting at the same issue. I think that bill was, frankly, better and less complicated. And, you know, Representative Bonner was telling us about her credentials with IT. Certainly, I have no reason to believe that any of that is not true. I think all of us are well aware of that already. We've heard that quite a bit. But her legislating needs some work. Because the language in the legislation, while she may have the IT experience, her legislation is severely lacking. And there are some real questions that need to be answered and dealt with in this underlying language. And frankly, we talked about California and the EU a little bit, both who have passed this, California is still dealing with litigation. But both of those entities, both California and the EU, have agencies who are tasked with overseeing consumer data and data privacy. Minnesota doesn't have that. We don't have that, and so we are putting a lot of onus on the AG without, frankly, you read the fiscal note, and there are a lot of things missing from that fiscal note that are not addressed. The cost of standing up a compliance operation, that's not free. There is a cost to that that's not addressed. It also doesn't address rulemaking. And the Attorney General's office, and in fact, in Representative Bonner's comments, she talked about how things are going to need to be adjusted. Well, the Attorney General's office doesn't have rulemaking in this language. This is a problem. I would also just say, draw your attention to the fact that, businesses are required to respond to written requests from the Attorney General in either 3 businesses or 5 business days. I'm not sure why there's different numbers there. That's a little bit confusing to begin with. But it doesn't spell out a request to who? Who is responsible for this? I mean, we all know, frankly, all of us in this chamber have legislative assistants. We have assistants who typically go through our mail. They might monitor our email and make sure that important things are flagged for us, whatever. They answer our phones for us and let us know when we have important phone calls that we need to return, whatever it is. This just says that a written request by the Attorney General to the business. Well, who in the business? Who needs to respond? When does that 3 business days start? It's not clear. It's not defined. And the last thing I would highlight before moving on are the civil penalties. There's a $2,500 per affected child penalty for each negligent violation. And there is a $7,500 per affected child fine for each intentional violation. Well, how is that determined? And who is determining it? There are a lot of problems. Like I said, I get Representative Bonner might understand IT, but maybe her legislating could use some work. The last thing that I want to touch on is going back to the Prescription Drug Affordability Board. I hope that we have outlined the very real concerns with moving forward with this prematurely, which I absolutely believe we are doing. There is plenty of, there are, 7 states, I believe, that are working on implementing prescription drug affordabilities right now, boards right now. This is already happening elsewhere. Minnesota should wait and see the data on this. We should make sure, rather than just assuming, we can look at the other legislation that other states have done and just assume, oh, don't worry, we'll get it right. We'll be the state to get it right. We often think that. We think we're smarter than everybody else. Well, guess what? We're not. I wish I could say we were, but we're not. And so rather than moving forward and being one of the mix of making mistakes and fixing mistakes, it just does not make sense to do this when there are states in the middle of this. We are already getting data back. Like I said, when I talk about New Hampshire, that number is not made up, and that is not some conservative think tank that's giving us that data. It is the PDAB chairman, Gary Merchant. He is the one who has told us that manufacturers' prices have come down, but the cost to consumers, the people who need the medication, their costs are going up. I don't know why we would ignore that. And frankly, I feel like we were told that we should ignore that we don't really know what's happening in New Hampshire. Well, that's what the chairman of the PDAB believes is happening. And so we should absolutely take that seriously. And on the access question, I actually, someone texted me and said, you are spot on when it comes to access. This is the problem. When we put these price limits, when we put these upper payment limits on these medications, it is not disputable. It's not debatable. It 100% disincentivizes research and development. It doesn't happen. And we've seen numbers that it stifles as much as 60% of research and development. And frankly, Minnesotans can't afford that. Minnesotans cannot afford the costs of this PDAB, whether that is in actual costs, when the cost of their medications going up for them, or whether the cost is less access to the medications we need. And because of that, this is an easy no vote. This commerce bill today that's before us is simply not ready for prime time. This commerce bill that is before us is experimenting, and Minnesotans are the subjects of that experiment. And I'm not doing that to my constituents. Thank you, Madam Speaker.
The member from Isanti, Representative Doubt.
Thank you, Madam Speaker and members. As we're closing out this bill here, I just wanted to point out a couple of things that I think are problematic. They're things that I talked about and offered amendments on. Number one, and I think these are reasons, unfortunately, to ask you to vote against this bill. Number one is the Family Protection Act, or the boat bill language that's in the bill. As I mentioned during my comments on the amendment itself, this really is concerning and problematic for our insurance industry here in the state of Minnesota. And insurance, I say it, that insurance industry, I don't mean to suggest that we want to favor corporations or anything like that. I just mean, insurance is there to protect Minnesotans, and unfortunately, I think that this language will result in less boats being insured and less insurance products and less affordable insurance products, and potentially less products being available to consumers in the marketplace, which ultimately results in less boats being insured in the state of Minnesota. And I think that's really problematic. I think that puts Minnesotans at risk when there are unfortunate, and I know there's not a lot of them, but when there are boating accidents where there is an injury, we want to make sure that people are protected and they do have access to insurance products that will protect people in the event that they are in an accident, and provide the sort of coverage and reimbursement for injuries or the sorts of things that would be required. That's what we want. We want to make sure that our boats and our lakes are safe in the summertime here in Minnesota, and we want people to enjoy our lakes and our water sports here in the state of Minnesota. We want people to buy and purchase boats, and particularly boats that are manufactured here in Minnesota. This has been a long tradition, and we don't want anything to hinder that here in the state of Minnesota. But that language is just really very problematic, and I think will have negative results for both boat owners and potentially Minnesotans that are injured by somebody operating a boat that is not insured in the state of Minnesota. And we're at greater risk of that because of this language. So I would ask for that reason to vote against this bill. But I think the biggest issue that I have with this bill is around the reinsurance issue. And this is an issue that we've debated on the House floor many, many times. The jury is back on this issue. The results are in. The data is clear. Reinsurance has been an incredible success in the state of Minnesota. Unfortunately, Minnesotans were disaffected by the ACA, the Obamacare, when it was implemented here in Minnesota. And the reason for that is simple. We had better coverage and better insurance coverage than the rest of the country, than the average of the country when the ACA was passed. So what happened was, for those of us that did it better, our results here in Minnesota were actually lowered to the median or mean of the country, and so Minnesotans were disaffected by the ACA being implemented here. What I mean by that is much higher premiums. What I mean by that is much higher deductibles. And when we've been through this numerous times on the House floor, there were many families. In many cases, you were talking about a family of four for their medical insurance coverage or health insurance coverage. They were paying $3,000 a month and a $13,000 deductible for a family of four, and they had to pay that before they got one penny of coverage. And so what happened was Republicans stepped up and said, this is unacceptable for a family of 4 to pay out of pocket $40,000 before they had one dime of health insurance coverage in the state of Minnesota. That is not insurance. And while technically, Democrats were able to say that more Minnesotans were insured because of Obamacare in the state of Minnesota, we all know now that that wasn't true. And the reason that wasn't true is while they had insurance, their deductibles were $13,000 and their premiums were $3,000 a month. I'm sorry, that's not insurance. When you have to pay $40,000 out of pocket before you have 1 penny of coverage, that's not insurance. And we know that's the fact because what we saw, and somebody on the House floor yesterday referred to it as charity care, and I find that term to be offensive. We shouldn't use that. We should get that out of our vocabulary. The proper term would be uncompensated care. What we saw is that uncompensated care at hospitals in the state of Minnesota actually increased after the ACA was passed here in Minnesota. And the reason for that was simple. And I'll tell you, before I say that high uncompensated care or uncompensated care at hospitals, meaning hospitals that weren't being paid for their hospital bills that patients were racking up, uncompensated care was actually the reason that folks were saying we needed Obamacare or the ACA in Minnesota. But the reality was uncompensated care actually went up after the ACA was passed and implemented here in Minnesota. And the reason was people could, while they now had insurance, they couldn't afford their deductible. So their hospital bills weren't getting paid. And so we actually had a higher amount of uncompensated care after the ACA's implementation here. And that's how we know, the jury's in on this. ACA, Obamacare was a failure here in Minnesota. There's no question about that. Rates skyrocketed for those in the individual marketplace. Deductibles went from $1,000 or $2,000 or $3,000 up to $13,000. And when you have a $13,000 deductible, you don't have insurance. And what we found is that many people left the marketplace and left insurance altogether. So what Republicans did is Republicans stepped up and said, how can we provide some stability to ever increasing insurance rates in the individual marketplace? And we put in place something similar to what we had before with our MCHA program, which is a reinsurance program. And that reinsurance program reduced rates in real money by 36% on average for Minnesotans. So premiums went down 36% for people that were buying insurance in the individual marketplace. Those were real results, not froze, not went down a little bit and then went back up. They went down 36%, period. End of story. Incredibly successful. And we were the first ones to implement that reinsurance program. We did it while I was, I'm supposed to say a line here to make somebody laugh, but they're not in the chamber, so I won't. When I was the speaker, we implemented this program, and it was incredibly successful. We led the country. We were the first ones to do this in the country. And it was incredibly successful, and it has been a model for other states, and I think 13 or 14 other states have done this now since we did it, and it has been incredibly successful. So the real problem with this bill is that this bill, and the bill author was given a target by leadership of like negative $230 million or something like that. I don't have the number right in front of me. But when we see a target on the budget targets like that, we know what's going on. And around here, we call that stealing money. So to make the numbers meet in all the other budget areas, the bill author was instructed to take 230, whatever the number is, $230 million out of the premium security account, transfer that to the general fund, and use that money for other things. So here's the real problem, members. We have a $17.5 billion surplus right now in the state of Minnesota. A $17.5 billion surplus. On top of that, the budget targets that Democrats have right now in the Minnesota House are increasing taxes by another $9.5 billion. So we have twice the highest surplus we've ever had in the state of Minnesota. And on top of that, now, somebody with any common sense would say, gosh, we've got this surplus that, equates to about 30% of our state's budget. We should expect some tax relief back. What a surplus means is you're collecting more money than you need to operate state government. So any level of common sense would tell you that what Minnesotans would expect is, well, we're going to get some of that money back. Now, maybe we'd get more money back if Republicans were in charge, but my gosh, even Democrats can see that this is too much money, and they're going to give some of it back, right? Half, 3/4, something like that. No, on top of spending the $17.5 billion, Democrats are raising taxes another $9.5 billion for a total of $27 billion of new resources available. And that's why what's happening in this bill is a real crime. And when we say stealing money from an account, that's what's happening here. So the people who count on this money to keep their insurance rates stable and low are going to be thrown, into instability. They're going to, for sure, jury's back in on this. We already know. We've seen what happens. Democrats tried to do this 4 years ago, and we saw what happened. You will see a 36% increase in premiums in the individual marketplace. On top of that, you will see the kind of normal increase you might see from year to year. But at a minimum, you're going to see a 36% increase. If you buy insurance in the individual marketplace in the state of Minnesota, and there's about 150,000 Minnesotans that do that, you will see, because of this bill, you will see a 36% increase in your premiums. That is a fact. But what makes it a real crime is that they're taking that $236 or whatever million dollars from this premium security account when they've already got $27 billion of new money to spend. I mean, this is the sort of thing that you should wear a mask and hold a gun when you're stealing that kind of money out of one of these accounts from people who need it. And who's impacted by that? Whose rates will go up 30%? The family farmers, a family of 4 that we remember from down in Winona, who are paying $13,000 deductible and more than $3,000 a month for their insurance. Those are the people that are going to see the increase. That small family farm. So those are the people that Democrats are stealing this money from. And when Minnesotans were told on the campaign trail this year, you should expect a tax cut. We're going to cut, seniors, we're going to stop taxing Social Security in the state of Minnesota. Well, we now know that was a lie. Democrats lied to Minnesotans about that. You know why? They can't say no to anybody. They need to spend that money. And not just that money, all of the other $27 billion, and on top of the $27 billion, because the $27 billion doesn't include this $230 million transfer out of the premium security account, and the $27 billion doesn't include all the fee increases that are hidden in all these other bills. And while Minnesota families are suffering and reeling from the highest inflation in a lifetime caused by failed Democrat policies, Democrats are doubling down and taking more money from Minnesotans. At a time when we have double the largest surplus in state history, Democrats are doubling down, and they're going to increase taxes $9.5 billion, which, by the way, equates to about a 10% increase in taxes across the board. That's what we're talking about, members. And in addition to that, they're going to steal money from those small family farms that can't afford health insurance because of the failed implementation of Obamacare here in Minnesota, which actually hurt Minnesotans. These are facts. This stuff's not open for debate. We have all the data. We've seen all the results. We've seen how much those premiums have gone up. And we've seen how much Minnesotans have been hurt. But Republicans are here, and while we're in the minority right now, we are mighty. And we're going to use our voices to make sure that Minnesotans know what Democrats are doing to them in this chamber, in this day. We're going to let Minnesotans know that Democrats are breaking their promises. We're going to let them know that Democrats are stealing their money and increasing their insurance rates. And we're going to let them know that at a time when they should expect a tax cut, which is what we would give them, Democrats are going to double down and increase their taxes 10%. So when you voted for Democrats, this is what you got, and we're going to make sure that people remember it. So I'm going to ask you, and this is your last chance, I'm going to try to let you, I'm going to save you from yourselves. When the board opens up, we should all vote against this bill. Not just for this reason, but for all of the reasons that my colleagues have pointed out. This is bad policy, it's bad fiscal policy, and it's broken promises. And you know what? It's absolutely typical of what Minnesotans can expect from Democrats. So while I'm disappointed, I'm not surprised. And I can't say we didn't tell you so. But just because we told you so once doesn't mean we're going to stop. We're going to make sure Minnesotans remember. So this is your last chance, Democrats. You got an opportunity to save yourselves. When this opens up, we can all vote no. We can send this back. We can get new targets. And we can stop stealing from Minnesotans who need that money, who are already reeling from your record high inflation. This is our opportunity to actually put our money where our mouths are, to actually give Minnesotans some of their money back, and to stop punishing them. But this is your last chance. So members, please vote red.
The member from Hennepin, Representative Howard.
Thank you, Madam Speaker. I just wanted to speak briefly on the important prescription drug affordability provisions in this bill. When we pass this bill, we will make Minnesota a leader in this country in the fight for affordable prescription drugs. Specifically, as members know, I've worked for years in the fight for affordable insulin. This bill will cap co-pays for Minnesotans with insurance, for affordable insulin, for Minnesotans that need access to asthma inhalers, for Minnesotans that need access to EpiPens. In many ways, this closes the loop in important work that this legislature has done over many years to ensure that Minnesotans have access to life-necessary prescription drugs at an affordable price. In addition, I am so proud to be voting for the Prescription Drug Affordability Board and want to thank Chair Stephenson for his work on this. I've talked to so many Minnesotans over these last few years that are just crushed under the weight of prescription drugs, that are faced with choices of, am I going to pay for my drugs or buy groceries? And they don't know where to turn. We have a complicated healthcare system, and Minnesotans are left throwing their hands up in the air. But the Prescription Drug Affordability Board in this bill is the answer to that equation and helps tilt the scales back towards Minnesotans. And I have to say, I'm struck always by the general arguments we hear from the other side on prescription drugs, which seems to be that, we've got this very complicated healthcare system. And by the way, it's complicated by design, by big pharma and the big money interests that are reaping billions in profits by it. But because it's so complicated, we can't risk rocking the boat. And members, we should reject that. We are not going to wave the white flag to big pharma and agree that it's okay. It's not okay. And this bill says that it's time to tilt the scales back towards Minnesotans to give access to every Minnesotan that needs it to affordable prescription drugs. If you want to make Minnesota a leader in a fight that is important to every community across the state, vote yes for this bill. Vote yes to make prescription drugs more affordable to all Minnesotans. Thank you, Madam Speaker.
The member from Stearns, Representative O'Driscoll.
Well, thank you, members, for the discussion this afternoon, and I want to thank all of my colleagues on the Republican and Democrat side for the civil discourse that we had today. Chair Stephenson, I want to underscore what you started with. You and I have, through the pandemic and this year now that we're back face-to-face, have found a way to, although have adversarial positions, find a way to be able to make time for both to be fairly heard, and so I do appreciate that. As I look at this bill and as I look at the conversation today, I'm going to boil it down to four things that I think every Minnesotan can identify with. I see the headline in the statewide papers, not tomorrow morning, maybe not 3 weeks from now, maybe 2 or 3 years from now. Bites and boats raise insurance premiums. Bites and boats raise insurance premiums. And we start getting to the paragraphs, the journalist who writes that is going to talk about Minnesota legislature changed the laws and said that insurance companies can't underwrite for dangerous dogs, causing premiums to go up. Second paragraph, although not covered under boat liability, Minnesota legislature, led by Democrats, has expanded coverage where coverage didn't exist in their policies. Could have been purchased in a separate policy, still available in the state of Minnesota, but was told it was too high, so we have to modify the current policies to wedge coverage in where premiums are not being collected. Premiums are going up because both homeowners policy companies and boat insurance policies are leaving. And I sure hope for your sake, Democrats, on this one, that it doesn't come out on the fishing opener weekend and when people are towing those boats up to the lake and up to the cabins, because that's going to be a really difficult conversation to have with your constituents if they see that. As I look around this chamber, Republicans are on their devices right now. Don't worry, so are Democrats on their devices right now. But the difference between Republicans being on their devices right now and Democrats being on their devices right now is the Republicans offered an opportunity for those very important devices, because if they weren't, everybody would be stopping what they're doing right now and listening to me. But I'm smart enough to know you're not. And it's not because of the message, it's because you need those devices. We need our devices to survive. And when Republicans offered an amendment to be able to establish a consumer bill of rights, that when you go in and somebody says, yeah, I think I can repair that for you, what the consequences might be. Democrats said, well, we've been working on the right to repair for a number of years. Maybe next year we'll protect the consumer. But right now, we hope to be able to pass this. We know it needs some work, but we'll just hope that consumers don't get taken advantage of too badly on this when we could have had a chance to do a consumer bill of rights. And the fourth and final thing that really disturbs me about this, as we have seen and as Representative Dowd has underscored, the ACA has raised havoc with the insurance market, the health insurance market. And Minnesota said, you know what, we're going to double down. We're going to remove underwriting from Medicare premiums, and we're going to scare the daylights out of our seniors who are on Medicare that they're not going to have coverage because they can't afford it. And what we're going to need to do is we're going to need to probably come back as Minnesotans with this crisis that was self-inflicted and self-created and create a reinsurance program for the Medicare supplement market. There's a hole in the bucket, for those of you who are familiar with that song. We have a chance today, dear Liza, to fix that hole in the bucket. With what shall I fix it, dear Liza? With a no vote on the bill today. Thank you, Madam Speaker.
The member from Anoka, the author of the bill, Representative Stephenson.
Thank you, Madam Speaker, and thank you, members. Started today by saying that, by thanking the members of the Commerce Committee for the good discussions and debates we had, and noted that we could be disagreeing on the policy without being too disagreeable, and I appreciated that. And I did appreciate that, but I think along with that, I have to acknowledge that I think we fell short of that on the floor today in one specific respect. I think that some of the comments that were directed towards Representative Bonner today went beyond the merits of the proposal that she advanced and into some personal comments about her, and I thought that was really unfortunate. I think we're better than that, and I hope that we will be better about that in the future. So I apologize to Representative Bonner for the way that debate unfolded. That's not what you deserved, even if people disagree with your bill. Having said that, this is a good bill that I'm proud of, and I hope people will vote yes.
The clerk will take the roll on the bill. Will the clerk please call the name of the member who is voting remotely?
Richardson.
Richardson votes aye.
Richardson votes aye.
The clerk will close the roll. There being 70 ayes and 58 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is House File 1938. The clerk will report the bill.
House File number 1938, number 1 on the calendar for the day, an act relating to financing and operation of state and local government, the second engrossment.
I recognize the member from Hennepin, the author of the bill, Representative Gomez, to explain the bill.
Thank you so much, Madam Speaker. It's my honor today to be bringing House File 1938 to the floor, which is our tax budget bill. This bill constitutes the largest tax cut in Minnesota history, regardless of what you may have heard. It contains targeted tax cuts. It puts money in the pockets of the Minnesotans who most need it. It contains all of Representative Dave Lislegard's incredible property tax division report, which is laser focused on property tax cuts and assistance to cities in response to what I'm sure that we've all heard in our communities, which is that, you know, home valuations are going up, property tax bills are going up right along with them. And this is related, of course, to the decisions that have been made in this body to not keep up with the costs of operating local government. So Representative Lislegard's, Chair Lislegard's property tax division report has permanent, ongoing property tax refunds targeted at folks who need it the most. It contains a transformational change to property tax refunds for renters, which Representative Coulter authored. And so it changes the property tax refund to a refundable income tax credit. And this is a really important simplification and fairness change to our tax code. Right now, there are over 100,000 low-income renters who are eligible for property tax refund, who just because of the timing and the paperwork and like the complication and the barriers leave that money on the table. So this is going to be a huge change, and it's really going to make our tax code more legible, more fair, and more equitable. As I said, it funds our cities and our counties. It adds $100 million a year each to local government aid and county program aid that goes across the state to help our local governments function, to help them keep their obligations to their residents and our residents. It contains local aids for housing and homelessness to respond to these dire crises that folks in our communities are experiencing. So this is, as I said, the largest tax cut in Minnesota history. It focuses on those who need it. This bill is going to improve lives. It's going to make our tax code more simple and more fair. It focuses on families and on children who are in poverty and on seniors who are struggling economically. And it helps us take steps toward that goal that that Governor Walz laid out for us of making Minnesota the best place in the country to raise a family. And I look forward to more discussion about this great bill. Thank you so much, Madam Speaker.
There is an amendment at the desk. The clerk will report the amendment.
Gomez is moving to amend House File 1938, the second engrossment, as follows. The amendment is coded A56.
The member from Hennepin, Representative Gomez, two-year amendment.
Thank you, Madam Speaker. This is an author's amendment. It's 7 lines long. You know, the first couple lines fix an error in the Social Security exemption. The next couple lines outline that we were able to make our working family and child tax credit much more generous. And then the last couple of lines are changes to the taxpayer assistance amounts in the bill. Thank you, Madam Speaker.
Any discussion to the Gomez amendment? All those in favor of the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Engen moves to amend House File number 1938, the second engrossment as amended. The amendment is coded A58.
Representative Engen.
Thank you, Madam Speaker and members. My A58 amendment is, in my belief, a way to show that every Minnesotan can have a little bit more support in some uncertain times. It would actually expand the list of infant care items that are exempt from state sales tax collections, and it would give a school supplies sales tax holiday this August for 15 days so that folks can go out and buy those items that they need to ensure that they have everything that's on that school supplies list. Prices are up. People are struggling. I don't think that this amendment picks winners and losers. It just tells every Minnesota family that we're going to be supporting them throughout some hard times. So I would appreciate a green vote. Thank you. And
There
request
is
a
an
roll call.
amendment to the amendment. The clerk will report the amendment.
Engen moves to amend his amendment to House File number 1938, the second engrossment as amended. The amendment to the amendment is coded A64.
Representative Engen.
Thank you, Madam Speaker. This was just a clarifying amendment to my amendment so that we have the correct data as to how much we're going to be giving folks relief. So again, I'd ask for a green vote. Thank you.
Discussion on the Engen amendment to the amendment. Representative Gomez.
This is a technical amendment. Please vote green.
All those in favor of the Engen amendment to the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. Further discussion. Representative Gomez.
Thank you, Madam Speaker. Thank you, Representative Engen, for bringing this forward. This isn't something that we heard in our committee or that there was a bill about, but I'm interested in the idea, and I would like to bring it into conference, and so I would urge members to vote aye on this amendment. Thank you, Madam Speaker.
Any further discussion on the amendment? Representative Engen.
Thank you, Chair Gomez. Really appreciate those words, and I think this is just a very common sense solution during some hard times. So appreciate a green vote.
All those in favor of the Engen amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Olson B. moves to amend House File number 1938, the second engrossment as amended. The amendment is coded A18.
The member from Martin, Representative Olson, two-year amendment.
Thank you, Madam Speaker. Members, this is once again an opportunity for individuals here on this House floor to make good on promises that were made this last summer and into the fall as we were entering the campaign season. And this would do it in a very responsible way. So this is, once again, the full exemption of the Social Security tax, and it's done in a way that would be progressively increased as we have budget surpluses. So it's going into the future. In the future, we have a budget surplus. We are then able to scale back the taxation on Social Security in order to exempt more and more and more people. Because the way that this is currently written is still a way in which it is not entirely helpful to the middle class seniors. Now, we've heard many times that on this House floor there is in fact a senior citizen who pays taxes on a middle class amount of money, and he said that he's fine with it and it wasn't actually all that much. But what I will tell you is that I know a man, he was born in the year 1928. He's now 94 years old. He'll turn 95 in June. And he graduated from high school, went to college. He was drafted into the Korean conflict. He fought against communism. He came home after the war. He got married. He raised a family. He farmed his entire life. He lost his farm during the farm crisis. He bought it back. He worked hard every single day of his life, members. He didn't retire until he was nearly 85. He now lives in a rest home, and he does not make enough money in order to cover the cost of his rest home. Now, members, let me tell you what happens when that occurs. When you do not have enough money to cover the cost of your long-term health care, the state will help you. But if you own farmland or any form of assets, the state will sell it. Now, members, that's my grandfather. My grandfather's 95 years old in June. He worked his entire life. He paid Social Security taxes his entire life. He lost his farm. He bought it back. Hard work every single day. Had to get his knees replaced when he was in his 70s because he didn't have time to walk places. He ran across the farmyard because he didn't have the time to waste. Raised hundreds of head of cattle and sheep and pigs, farmed hundreds of acres, and he accomplished something. The American dream, members, the American dream. And now that American dream is being threatened. Now, I'm not saying that fully exempting the Social Security tax on him would allow him to be able to afford his health care. His health care is very expensive, and as a family, we've had to actually increase the amount of rent that we pay. So I farm with my grandpa. We've had to do things to make ends meet on those areas. Same thing occurred with my other grandfather on my father's side. He actually cost more, his care cost more than what we were actually able to pay in his rent, plus his Social Security, and everything all combined, it was still $40,000 short of what he was costing. And so, members, that was a real strain on my family. You talk about, people like to talk about farmers having all sorts of money every once in a while. Well, we're dirt rich and we're cash poor, and that really hurt my family. That really hurt it. I don't know how we made it through. But in the end, we made it through. My grandfather passed away, the other grandfather, passed away in 2020, and so we no longer have to pay for his care, and that's a sad thing. Members, we need to do this. This is the right thing to do. The greatest generation went off to war. They fought for our freedom. They raised families, good families. They educated their families. They created what we have today. They have blessed us with what we have today. Let's get off their backs. We've been on their backs riding the greatest generation for generations. It's time to pick up the mantle ourselves and become that great generation. We may not be able to surpass them because, members, they were a pretty great generation. But it's time for us to do our part. I'm so tired of people saying, let's take the money from the seniors. Because, members, taking money from my 94-year-old grandfather is worse than taking candy from a baby. Because a baby may grow up and then has a shot at buying candy someday. My grandfather no longer has the capacity to work. You take the money from him, he cannot get any more. Members, vote green in order to fulfill your promises in a responsible way to get off the backs of the greatest generation, pick up the mantle, and let's be a great generation ourselves. Thank you, members.
Discussion on the Olson Amendment. Representative Gomez.
Thank you, Madam Speaker, and thank you, Representative Olson. So a few things. First of all, our approach to Social Security in our tax bill will ensure that more than 3/4 of seniors, 76% of seniors who are collecting Social Security benefits will pay no tax on those benefits. This includes couples filing jointly who make $100,000, who make up to $100,000 a year. And I'm sorry about your family being one of the many, I would say millions of victims of a profit-motivated healthcare system and a real failure of us collectively to care for elderly people, for disabled people, for young people who are in really tough financial circumstances. I would dispute that a few $100s a year would substantively impact, somebody who's facing long-term care costs, nursing home costs that are just really, out of control. In part, again, because people are pulling profit out of all of those systems. And that's a policy choice that we make. So this is an interesting kind of approach to paying for this incredibly costly initiative. So the budget reserve, you're taking the money out of the November forecast. So I'm just going to read because I learned a lot about this in preparing for today. When there's a balance in the November forecast, and historically these have been used to pay back shifts, to pay back borrowed funds from other non-general fund accounts, but it has not been used to do what is proposed here and what's proposed elsewhere in these amendments, which is to be used for permanent tax reductions, because these are, by definition, not the kind of revenues, so to speak, that you can make permanent decisions with. They're one-time dollars. And there is, in 16A.152, there are a number of kind of actions that have to be taken before you can do anything else with a November forecast positive, unrestricted balance. And so what that means is that a positive balance in the November forecast means that we can make up for budget trickery and for gimmicks and for shifts. What we're doing here is using a budget gimmick to pay for an incredibly expensive ongoing expense. And so just kind of out of the gate, I want to say that. And there's a reason that we're doing the proposal for a full Social Security exemption in this way. And I'll tell you why it is. It's because our approach to Social Security treatment, where 76% of seniors would pay no Social Security tax, a couple making up to $100,000 would pay no Social Security tax. In the first biennium, it costs $409.2 million, still a lot of money. Doing the full Social Security subtraction, so to pay for those top 20% of seniors, would cost $1.26 billion in the first biennium. Our approach to Social Security in the second biennium costs $478.7 million. The full exemption in the out biennium is $1.495 billion. It's almost $1 billion of difference. And so I asked this question in committee. If you are proposing to spend an extra $1 billion in the out biennium on the top 20% of income earners, 4% of income earners, then you're choosing them as winners, and who are we choosing as losers in this bill? Because if we were kind of going about this honestly, then you would have to come into my bill and cut $1 billion in the out biennium. And I want to tell you a little bit about what we spend that $1 billion on in the out biennium, because I think that you'll find it, logical and targeted and like spending that we can all agree on. In the out biennium, we spend that $1 billion on property tax refunds for people who are having trouble managing those bills. 45% of people who get homestead property tax refunds are elders and people with disabilities. 45% of those. Those are our lowest income seniors who we could spend this $1 billion in the out biennium and they would see no benefit whatsoever. We could do that. That would be a choice. And that's what's being advocated for, but we're not having an honest conversation about it. I talked to you about changing the property tax rebates for renters from this separate process and making it a refundable income tax credit. Well, 35% of people who get the property tax refund for renters are seniors and those with disabilities. People have a wrong idea about who renters are in our state. Renters are people of all ages and of all backgrounds and of all income levels. They are more likely to be low income, and this is why our investment in them is so important. If you wanted to spend $1 billion on the top 20% of income earners, of seniors, then you would have to cut local government aid. You would have to go to your cities and your counties and tell them, we know that for 20 years, our investment in our local government partners, we have violated our contract with them that we made during the Minnesota Miracle. And we have not kept up with the cost of providing those critical public services. And so many of us in here were local elected officials before joining this body, and so we know what it means when the state does not keep up with its obligations to our local government partners, that our residents suffer. So I would urge a red vote on this amendment. I think, and we've worked a lot on this issue. We've talked a lot about this issue. We have come up with a balanced approach that is more legible for people so that they can understand if they're paying taxes on Social Security or not. And we've balanced that both with investments in our budget, in our tax budget, and these tax cuts that are targeted to those who actually need it. And we are in other places in our budget, in Chair Noor's committee, we're making historic investments in nursing homes and long-term care facilities and making sure that the people who are charged with the care of our elders are actually compensated adequately. So, I guess we have to take a global look at what we're doing here when we're talking about, an extra $1 billion, an extra $800 million. Thank you, Madam Speaker. Please vote no on the amendment.
Representative Olson.
Thank you, Madam Speaker. We all in the last election cycle, many of us made comments, made promises. They talked about what we were going to do with this massive surplus. I don't know of anyone who said, we're going to spend it all. I don't know of a single person who was campaigning on that idea. I do know the majority of the individuals on this side of the aisle campaigned on the idea of fully exempting Social Security. And I know that there is more than a handful of individuals on the other side who said, we need to fully exempt Social Security. This is your opportunity to do so, members. Now, as soon as the election results came out, we saw a really awkward moonwalk out of the room. People started revamping their comments. We started saying, members, less than 50% of Minnesota seniors pay taxes on their Social Security anyways. You know why, members? Because anyone who can afford to leave this state does. Anyone who can afford to leave the state of Minnesota in their retirement does. That's why less than 50% of Minnesotans pay taxes on their Social Security today. And we will continue to lose those immensely important individuals. The generation that has the knowledge, the generation that's passing the baton to the next generation. We will lose those individuals at a rate that you cannot even imagine. We've already seen half of them leave. Only half of Minnesota seniors pay Social Security tax. Yeah, anyone who can afford to leave does. Anyone. Now, members, I think it's funny when we're talking about calling this a gimmick or a way that we're doing something that's never been done before. We're taking the money and we're paying for it in a way that it's not meant to do that. Members, we're paying for so much stuff this year that has never been done before in a way that is almost unimaginable. We are raising taxes on Minnesotans to the tune of tens of billions. Billions of dollars, 3.5 in the Transportation Committee. We've got 9.5 here. We've got 2.2 there. we've got billions of dollars worth of tax cuts or tax expenses and no cuts. We'll say substitutions or we'll say credits. I like that. We really like credits. We've got some of that. But members, we are seeing massive spending, 30% increase in our state's spending this biennium. I've never even imagined something so large in a way that I've never even conceived of being possible. So to say that we don't do this is just inaccurate because, members, 90% of the things we do here are ways that we don't do it, and we've never done it before. So that's a poor argument. Members, this is the right thing to do. This is the right thing to do. We don't need the money. Maybe you think you do. The state does not. We need to get off the backs of our seniors. Encourage them to stay here. Encourage them to spend their retirement here. Tell them that we would love to have you in our state. Members, I already know how you're going to vote. We've already had you press your red button. We already know. So I will not ask for a roll call. But we know where you stand. Minnesotans know where you stand. And Minnesotans know how valuable your word is. So be careful when you say a promise next time.
The member from Dakota, Representative Kosnick.
Thank you, Madam Speaker, and I appreciate the amendment to deliver on the promise that many of us made to eliminate the tax on Social Security income for our seniors. And we had an answer from the majority, the author of the tax bill, talking about all the other things that we spend money on in this state. Well, they're not intrinsically tied together. It's more of a moral issue of double taxation on those that have worked long and hard in our state, and they would like to be like so many other states and not be taxed on their Social Security income. I would suggest to the chair of the tax committee, you could raise the exemption and still not deliver on your promise, but you could raise the exemption to those making $150,000, and you would include 99% of the seniors that are receiving Social Security income instead of 76%. Those that are at the higher income and are seniors that have worked hard, they deserve that. We shouldn't demoralize hard work and fiscal accountability. In fact, many of those seniors that might be at the higher incomes in my community are those that are volunteering, supporting our communities, working in our Lions clubs, our Rotary clubs, Kiwanis, our VFWs, and they're also the ones that are first to write checks to support our schools and their fundraisers. And so I don't think we should be engaging in this class warfare. It's double taxation. Our seniors across the state have asked us to eliminate that double taxation on their Social Security benefits. They've earned them, and we shouldn't be taking from them. It's amazing that we can't do more for our seniors, and the Democrats are breaking their campaign promise of eliminating Social Security tax repeal, especially when we have a historic surplus, and you look at the overall budget that's being thrown at us, that we're raising taxes $9.5 billion, and then raising fees to make it all closer to $10 billion. And so I appreciate the amendment, Representative Olson, and I would encourage members to vote yes.
Further discussion. Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Anderson P.E. moves to amend House File Number 1938, the first engrossment as amended. The amendment is coded A35.
Thank you. This amendment...
Representative Anderson, to your amendment.
Thank you. This amendment does two things. It strips out the language on the e-poll tab from the bill, and it also adds language that says that the rules that were in effect at the time games were approved need to stay in effect unless this legislature by law changes them. And I want to start out, this was a shock, I think, to this side of the aisle, the members on the tax committee. There was no hearing on this provision, and it showed up in the omnibus bill on a Monday morning when it was posted at 11 a.m. And our charities had until 5 o'clock on that day to learn about it, sign up, and come in and testify. So the process was horrible. It was very last minute. And it's clearly an attack on our charities. It's an attack on our bars and our restaurants. It's an attack on the employees that work for the charities, all the entities, all of our nonprofits that do such great things for our communities. We just handed out a list of 1,100 charities across Minnesota. This is from the Minnesota Gambling Control Board. There are 1,100 charities that do pull tabs in Minnesota. They are in every one of our districts, and they do amazing, amazing work. And they have since 2012. As you know, the history of this, in 2011 and 2012, this past legislators and Governor Dayton were trying to find a way to fund the Vikings Stadium. And there were lots of debates about other casinos and even a state-run casino. And in the end, this was what was chosen. It was to allow more charitable gambling in e-pull tabs and to use a significant chunk of that tax revenue to fund the stadium. And it has been successful. Last year, there were $4.5 billion that were spent, gambled on the games. And e-pull tabs are 54% of this. Charitable gaming brought in $180 million in tax revenue last year. $180 million. And charities donated over $130 million to things in our local communities. I know there was a bill 2 years ago that Rep. Stephenson had that was eliminating, essentially, electronic pull tabs. It didn't go anywhere. I think it passed this body, but that's about as far as it went. And there was a fiscal note on that, members. There was a fiscal note. And that fiscal note said that by eliminating e-pull tabs, it would reduce taxes significantly. It would reduce local wages for the gambling at about $36 million. It would reduce revenue to the bars that are getting rent in some cases from the charities at $29 million. It would reduce local sales taxes and local contributions. It's significant. And for some reason, this omnibus tax bill doesn't have a fiscal note. Because if we accept the language that's in this bill, you are going to see charitable gambling receipts drop anywhere from 25 to 60%. Those are the predictions. 25 to 60%. And you have $180 million in tax revenue. So let's say we go on the low end and we say it's a third. Then this omnibus bill should have a $60 million fiscal note on it if this provision stays in there. $60 million, but it's not in there. It's not. And I want to talk very briefly about why I think we're at this point. As we all know, there was a lawsuit, and then there was an overturned lawsuit, and it happened in about 2019. And the last suit essentially said that we could do nothing and everything is fine. Absolutely nothing. There was the Gambling Control Board had essentially created an unpromulgated, Harry, I need your help, where's Harry, rule, which meant that it didn't go through the rulemaking process. And that rule, which was in 2019, said, hey, we're going to allow slot machines with the open all feature for the forever. And That was what the lawsuit was about. And in the end, the court said that you couldn't do a rule like that. You had to do it essentially either no rule or something through rulemaking, because the language is vague. It can be read either way, and it's vague. And that's what they found. And so we find ourselves here today where one side of this debate is trying to have us legislate something that doesn't exist currently in state law. And it is something that will greatly, greatly, greatly harm our communities and harm our charities across the state. I want to give you some examples. Something that is White Bear, right near me. Merrick is a nonprofit. They do charitable gambling across Washington and Dakota counties. But one thing they also do is they serve 400 adults with intellectual and developmental disabilities. And the proceeds from the charitable gambling go to help those 400 adults. They go to help equipment. They go to help a plastic recycling program that Representative Curran has talked about and advocated. That's where these charitable gaming funds go from that particular charity. Northern Minnesota, and I don't want to get into districts, but the Eveleth Elks Lodge, the Gilbert Fire Department, the Snow Devils, Middle Minnesota, the Optimist Club of St. Cloud, the St. Cloud Youth Hockey Association, the Eagles, Erie in St. Cloud, the VFWs in St. Cloud, the Golden Gloves Boxing in St. Cloud, to areas like Mankato, the Nicollet Lions Club, the St. Peter Hockey Association. Closer to me, the city of Lexington, Lexington Fire Department. I have a letter from the Lexington Fire Department that says the Lexington Firemen's Relief Association operates gaming at Cowboy Salon, who also benefits. It's next door to the fire station. And the fire department, 17 members, relies on charitable gambling to pay for our fire trucks and our equipment. The following phrase is proudly printed on the outside of each of our apparatus. This truck was purchased at no expense to the taxpayers of the Lexington Firemen's Relief Association from charitable gambling proceeds. All 5 of the fire trucks in Lexington, Minnesota were 100% paid for with charitable gambling proceeds. Also close to my district, Blaine. The Blaine Festival has donated $7 million to people in need. $7 million. In youth sports, Anoka Ramsey Athletic Association. They say that a significant portion of their community outreach is funded by charitable gambling proceeds. A significant portion. And they give money to Anoka High School graduating seniors for scholarships, amongst many, many, many other things. Members, this bill, this language is a direct attack on our charities and our communities. It's not needed, it's worked, things have worked. Something else I want to mention, we're all, I think, very proud that the Viking Stadium is paid off 20 years in advance. That's an amazing, amazing accomplishment. But that Viking Stadium is going to have needs. They're going to have, at some point they're going to remodel it, at some point they're going to, and they've said that they are going to have needs. So they are still going to need tax revenue. And this gambling provision, as we've been doing it all along, is more than enough to pay for the needs. It's more than enough. Minnesota nonprofits rely on this. They rely on the dollars. There are youth hockey associations that have built arenas, and they're using the charitable gambling proceeds to pay the bonds. If this goes away, What are they going to do? What are they going to do? There are Legion posts who've renewed leases. And again, they're relying on these proceeds to pay that rent and to stay alive. There are bars and restaurants who have partnered, who are getting bits of rent from some of these nonprofits. And after what COVID did to our bars and restaurants over the last couple of years, why would we hit them again? These bars and restaurants, in many cases, have brought in internet, they brought in more electricity, technology. They've had huge, huge upfront costs in some cases so that they could actually do this. And now this legislature wants to say, pull the rug out and say, no, you can no longer do that. And I'll quickly talk about the open all feature, because I think that's what we're talking about. And again, the courts found that the language is vague and that the Gambling Control Board, it's fine how they were interpreting it. And if the Gambling Control Board wants to make a rule in the future, they should use rulemaking, proper rulemaking. But in the meantime, it's fine. There's nothing that was done wrong. We have not been operating illegal charitable gambling for the last decade. It's fine the way it is. What are the differences between a tablet, an e-pull tab, and a slot machine? There are numerous, numerous differences. And the language from a decade ago specifies that. You can't have wheels rolling and those sort of things. You know, let's see, you can't accept cash. That's a big thing. Battery operated, cabinets, spinning reels, the screens. And I play paper pull tabs once in a while. And an open all feature on a paper pull tab is you pull the tabs. That is an open all. It's the exact same thing. And that is why the Charitable Gambling Board, I suspect, has allowed these since the beginning, since 2012. Again, we have not done anything wrong or illegal. There's no court case that says that. It just says the Gambling Board, if it wants to set a standard and create a rule, they need to go through rulemaking, proper rulemaking process. But they don't have to do it. They could just leave it the way it is. And folks, 90% of the games, of the e-pull tabs, have an open all feature. And that is the common thing across this country. That is the norm across the country. So why would we even consider changing what we have? Why would we hurt our communities across the state? Why would we hurt our charities across the state? It's working. It's working, and it's paying for, amongst other things, a stadium, and probably, my guess is other stadiums down the road. It's working. So I ask members to support the amendment, and I will stand down. Thank you. And I will be asking for a roll call on this.
Representative Anderson requests a roll call. Seeing 15 hands, there will be a roll call. Discussion. Representative Gomez.
Thank you very much, Madam Speaker. So that was a lot. There was a lot there, and we'll go through it bit by bit here. So some of the facts were accurate. In 2012, the Minnesota legislature passed, Governor Dayton signed into law, the legalization of electronic pull tabs. But part of that deal was with the sovereign tribal nations on whose land Minnesota stands, on whose land we all stand right now. Minnesota is 100% ceded treaty lands. And so part of that 2012 deal was very explicitly that electronic pull tabs were designed to be facsimiles of paper pull tabs. And they must be open like paper pull tabs, which means that a player should activate or open each pull tab ticket and each line and row therein. and that they could not include, the design could not include representations that mimic a video slot machine. That was part of the original deal in 2012. So we talk a lot in this chamber about norms and conventions of this institution. We're stewards of this institution today. A lot of people were stewards of it before us and will be afterwards. So we're here in this moment, stewards of this institution. And we talk about norms, and we talk about conventions, and some of the norms of this institution help us to navigate changes in power and kind of like help to keep us all focused on what our work here is, and our work here is for the people of Minnesota. But we're very clear in this moment that there is a norm of this institution that we will not be upholding. And that is the norm of breaking our promises to tribal communities, to tribal nations, to sovereign tribal nations, on whose land we are currently standing. So we are breaking from that convention, and we're breaking from that norm here today with this language. And so that context, that piece of context, of omitted context, is very important when we're considering the measures that are included in the tax bill related to charitable gaming and to the e-pull tabs. We will be keeping our promises. We are stewards of this institution, and although I didn't make this promise in 2012, and most of us didn't, this institution, this state government, made promises to the sovereign tribal nations, the 11 federally recognized sovereign tribal nations on whose land we stand, and we will be keeping our promises. And that's a fact. Now, nobody disputes, because as you said, Representative Anderson, you distributed these lists. Nobody disputes that there are organizations in each of our districts that do important work with these dollars. And we've heard loud and clear from them. We've heard loud and clear from them. But what we are actually talking about here is one small thing about the design of e-pull tabs. The people who come and tell you this will destroy e-pull tabs, they're shooting e-pull tabs in the head, this is going to destroy e-pull tabs, it's not so. We're going from touching a screen one time to touching a screen one time to go to the new e-pull tab, and one time each in the case of, they're mostly 3 lines, right? 3 touches. We're going from 1 touch to 4 touches. We're adding maybe 3 seconds to the time that it takes to play one of these e-pull tabs. And so we have an industry, that I was happy to listen to, and we received a lot of testimony from them. But we heard you repeat something that I just find so absurd. I gotta say, it's going to decrease the revenue 20 to 60%. So at first I heard that, I'm like, man, that's a lot. That's a lot. So I started asking a couple questions. I was like, where did that come from? And people are like, well, there isn't a study because nobody's done this. And so it's like, how do you know that you're being fed a made-up statistic if it says something like 20 to 60%? What does that even mean? I literally don't know. But what they're asking us to believe is that having somebody going from touching a screen 1 time to touching a screen 4 times is going to mean that all those people who enjoy playing e-pull tabs are going to say, you know what? Take this device back. I'm done. I'm never doing this again. It strains. It's kind of an incredible assertion. And as I said, there's a lot of There's obviously a lot of energy around this. There's a lot of feeling around this. As we said, there are great things that happen because of this money that's going into these organizations in all of our communities. But this small change to the ePull tab open all feature, and you're right, the appeals court did say that the language in statute is vague. And guess what we're doing? We're clarifying the language in statute. That's what this does. That's what we're doing. And so, we have to kind of take a little step back from some of the alarmist kind of quote unquote information that's being shared with us by an organized, powerful lobbying interest group who a lot of us are appreciative of, but nonetheless, that's what they're doing. We have to weigh that against whether, in this moment, when it's our choice, we're going to keep our promises. And I'm very clear, and our caucus is very clear, that we're choosing to keep our promises. I would urge a red vote on this amendment. Thank you, Madam Speaker.
Discussion. So many. The member from Dakota, Representative Hudella.
Thank you, Madam Speaker. My friend Wade served a full 20 years in the Special Forces. He was shot 9 times rescuing a hostage in Afghanistan. His body armor picked up 6 of those rounds. 3 of the rounds got through to him, mostly in his arm and in his hands, but he ended up in Walter Reed for a while and then VA Medical Center going through recovery. How I met Wade, how we became friends now, I run a military nonprofit when I'm not here. We receive a lot of revenues from electronic pull tabs. I had gotten a letter from this individual before I knew Wade thanking me for the equipment donation that my organization sent. It allowed his kids to be able to play hockey, and his letter went on about how our organization was able to give his entire family something positive to rally around during their darkest times. This is an individual that was inches away from death, that shouldn't have made it back, but he did. This bill will directly damage organizations like mine. It will reduce the amount of proceeds that we receive. It simply will. We receive support from many of the organizations that are on this list that came out. And to me, that doesn't make sense. I know there are a lot of very reasonable people. It was mentioned that we all have these organizations in the district. These are real people in our community, real people like Wade that we are helping every day. And to me, it doesn't make sense for organizations like mine to be able to help less people like Wade in order to pay back a major donor.
Discussion. Representative West.
Thank you, Madam Speaker. All right, this is a really important issue because in Blaine, the Blaine Hockey Association generates, just in the last 12 months, $13 million just from e-pull tabs. And if you have kids who play hockey, you know hockey is very expensive. It is expensive even with this charitable piece, and it will only get more expensive. And this whole debate's about this current game has an open all feature that needs to be changed. Well, I don't know if you've played pull tabs before, but what human opens a pull tab one line at a time? So it's ridiculous. It's going to be incredibly damaging to Blaine, incredibly damaging to the Blaine Hockey Association. And just for a tiny, meaningless change, but no, it's not meaningless because it's going to cost significant money. So we shouldn't be doing this. This is a completely unnecessary change that is going to cost the Blaine Hockey Association
real dollars because their current game will be illegal, and then they have to reapprove a whole new game that we know will generate less money for hockey in Blaine.
Discussion. The member from Sibley, Representative Harder.
Thank you, Madam Speaker, and thank you, Representative Anderson, for bringing forth this amendment. I appreciate it. Everybody should have gotten that that email about e-gaming, and you should have received one from me as I said, hello, fellow representatives. I am a Lions member, and in my district, every city has an organization that volunteers and raises money. So as a member of the Henderson Lions, we're a small group of about 18 people, and we do the e-gaming. And in 2022, we raised roughly $23,000. And most of the money is used to support youth in our area. And I just want to share a few things of the good work that we do. So we support the robotics team, the new Minnesota New Country School in Henderson. We have provided funds for smart boards. In the school district of Leeser Henderson, we provide scholarships. We also provide diabetic response kits for the kids that have diabetes. In the St. Anne's School District, we have provided funds for playground equipment. We provide funds for Special Olympics. We provide funds for parks. So this amendment is important to me because it does affect me personally, because we do good work on behalf of the people of our area. So please support this amendment. Thank you.
Discussion. The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker, and thank you, members. And I know we're trying to move this along, but I just want to let everyone know that every member on our side of the aisle wants to speak to this. And so those of us who have had the opportunity to speak know that their concerns are echoed by everybody on our side of the aisle. And I just want to go back to a couple things of why this is important to our local charities. First of all, how it was done. This wasn't in a bill. This just showed up in committee, and they were blindsided, and they feel so betrayed. I have a very small VFW in Hamel, the Osseo Maple Grove American Legion. They were calling me, texting. The gentleman from the Osseo Maple Grove American Legion was able to make it and testify. But so many more people want to weigh in on this. They weren't brought in as stakeholders and coming up with a deal or trying to figure out how we can manage this. They were just told, the rug is pulled out from under you. Your number one revenue source is going away. And they feel betrayed. And that's why we are fighting so hard for the charities on this. They do so much good work in our communities, and they pay more in taxes than they have left over to give out in our communities. Members, that's bonkers, to quote Representative New Brindley. So I just urge a green vote on this amendment because this is not the right time. And just to do this so quickly when they have had no time to prepare, when there is no sense of why this is happening in the middle of the tax bill, members, this is not the right policy to do. It will undercut our charities, and they are devastated by this. Some of our charities may close. So I urge a green vote on this amendment, and I look forward to everyone getting on board to support helping our local charities survive.
The member from Hennepin, Representative Nelson.
Thank you, Madam Speaker and members. Representative Chair Gomez spoke about promises made. Well, and she wasn't in the room when those promises were made. I was. Part of the negotiations to get the Viking Stadium built. I was there when the promise was made that they were going to use these electronic pull tabs, and they were not supposed to look like slot machines. And that's what they put in statute, and it may be a little vague, but that was the promise that was made in the room when the decision was made, and the tribe said, okay. And now we want to go back on that promise. We need to fulfill that promise and support this provision in the bill.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will call the member who's voting remotely.
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 64 ayes and 64 nays, the motion does not prevail. The amendment is not adopted. Hey, Sean, let me double check. Next amendment is the A32. There is an amendment at the desk. The clerk will report the amendment.
Robbins moves to amend House File Number 1938, the second engrossment as amended. The amendment is coded A32.
Representative Robbins to the 832 amendment.
Thank you, Madam Speaker. I'm sorry, I thought we were doing the 828 on my list, so I wasn't ready, but here we go. So members, I am rising and asking you to support the 832, which directs the Department of Revenue to use the money that's in the bill for the film tax credit to instead be used to increase the dependent exemption. Members, I had a bill this session that was trying to provide tax relief to families. It would have doubled the existing dependent exemption, and I really feel that it's important when we think about tax policy to make sure that it's broadly applicable. And so that bill never got a hearing, as did most of my bills not get a hearing, but I wanted to draw attention to this issue. One of the ways that I think it would help families most is if we, instead of doing lots of little credits and little deductions and things, that we just gave them an increase in the dependent exemption, because then they can use it how they want. Families have so many different needs that we can't possibly anticipate, they can't possibly anticipate. For those of you who've had children, you know, just things come up. And so giving families the flexibility by an increase in the dependent exemption, I think is good for families and good for tax policy. So since that bill didn't get a hearing, I thought I would like to at least offer this amendment and make a small attempt at improving the dependent exemption. So I urge a green vote. Thank you.
Discussion on the Robbins 832 amendment. Representative Gomez.
Thank you very much, Madam Speaker, and thank you, Representative Robbins. I think that we share a commitment to making sure that families and young people have benefit from this bill. That being said, I would ask members to vote no. We do have kind of a balanced approach between our credits and our, that are for, for this purpose, for encouraging economic development through film and TV in our state, and that direct assistance to families who need it. So I appreciate the amendment and appreciate the discussion, but I would ask members to vote no. Thank you.
Further discussion, Representative Robbins.
Thank you, members. I would like to request a roll call.
Representative Robbins requests a roll call. Seeing 15 hands, there will be a roll call.
Thank you, Madam
Representative
Speaker.
Robbins.
Thank you. And
Sorry, it was Representative Kwam was waving, so I was laughing. Representative Robbins.
Thank you. Well, members, I urge a green vote. We need to do more for our families, and it shouldn't be based on just individual circumstances that might not be broadly applicable. This is good tax policy. Vote green.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will call the name of the member voting remotely.
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 58 ayes and 69 noes, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Kosnick moves to amend House File Number 1938. The second engrossment as amended. The amendment is coded A33.
The member from Dakota, Representative Kosnick.
Members, the A33 amendment is an effort to strengthen our families and encourage our families that are being decimated by the $10 billion in tax increases and fees in this budget. And so we should be able to take a little bit of the funds and encourage families who will be hurt hardest under this budget. The dependent care credit will help more middle-class families in Minnesota and help them care for their children. I ask for support of this amendment, as families will be facing $9.5 billion in tax increases and some additional fees if they're renewing their auto tabs, if they're purchasing something, the sales tax is being increased on them, if they purchase a new car, if they renew their tabs, and a whole variety of other fees are being thrown against Minnesotans. And it's amazing to think that when we have a $17.5 billion surplus, that Democrats are raising taxes $9.5 billion. And with this increase in taxes, government is growing by 40% under the Democrats' plan. I urge your support of this amendment for the dependent care credit to help Minnesota families that will be paying the $10 billion in fees and taxes.
Discussion. Representative Gomez.
Thank you, Madam Speaker. Thank you, Representative Kosnick. Again, I'm going to start by saying that I think we share a concern about the realities of trying to afford childcare in our state and in this economy.
You just need to move some papers.
Oh.
There we go.
Oh, weird.
Representative
Okay,
Gomez.
Never seen that happen before. Representative Katiza-Wattoon has worked really hard on this over several years. We couldn't fit it into what we did here. We made a kind of a call that we were really going to go all in on child poverty this year. But you know, I really appreciate the work that's happened on the Child Independent Care Credit. The fact of the matter, right, is that families have trouble finding care in Minnesota. It is just so expensive. It's in some cases as expensive as a university education. This is especially hard if you have, you know, several little ones who are preschool aged. But, you know, as I said before, also, though, we have kind of designed a balanced bill that we want to bring into conference. This is very much in the conversation. You know, a much bigger position is in the Senate bill, and so we're going to be having those conversations in conference. And so on this one today, I would ask members to vote no, but please know that we share a concern about this issue, about affordability and quality care for our youngest learners. Thank you, Madam Speaker.
Discussion, Representative Koznick.
Chair Gomez, thank you for those comments. I'm glad that there is some agreement. It's unfortunate that you said we couldn't fit it into the budget. Members, we have a 40% growth in the state government budget that's being proposed, $72 billion with a B, and we're asking for $44 million extra. Representative Katiza-Wattoon, I actually appreciated your bill and was thinking of authoring one on my own, but instead I decided to support yours, and I hope that we really can continue to empower families and encourage them to provide for their children as best they can. It is very expensive. I remember when I had my two daughters were at the same time both in childcare. Those are tough to manage financially, but we figure out a way to get through it. I was blessed to have a good daycare nearby, and it is expensive, and I think this helps more families absorb the cost of life, increased inflation, but unfortunately $10 billion worth of taxes are thrown at them as well. But once I got done paying for the child care, I realized how much extra money we had, and it allowed us to buy a bigger house so that we could house our kids. And so I hope that we will continue to do more work in this area and empower families and encourage families with children to be able to care for them so critically. So members, I ask for your support, and Madam Speaker, I would request the roll call.
Representative Koznick requests a roll call. Seeing 15 hands, there will be a roll call. Further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will call the name of the member voting remotely.
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. Koznick votes aye. There being 58 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Whitty moves to amend House File Number 1938. The second engrossment as amended. The amendment is coded A55.
The member from Dakota, Representative Whitty.
Thank you, Madam Speaker. The A55 directs Department of Revenue to use $44.3 million from the film tax credit to raise income eligibility for homestead credit. We all have heard, and I've heard in my district of Lakeville, the rising property taxes and how it's hurting our families. I actually heard of one who actually had to sell his property because he was overwhelmed by the rise in his property tax. Around the state, there needs something to be an ongoing direct property tax relief. Although there is a one-time property tax relief in this bill, this issue is affecting many Minnesotans, and we need to provide direct ongoing tax relief to the middle-class Minnesota families. When I was going door to door talking to people in my district, I heard over and over that Minnesotans want a meaningful, permanent tax relief. Minnesotans have been hit hard by inflation and rising property tax, and they're asking for this relief. This is a tax bill does not provide that. My amendment addressed that, and by providing more ongoing property tax relief. I hope you can support my amendment. Thank you.
Discussion to the Whitty Amendment. Representative Gomez.
Thank you, Madam Speaker. Thank you, Representative Whitty. Again, we all heard from our residents about what's going on with property taxes in our state. And Representative Lissagard's property tax division spent almost all their time working on this issue. And what has happened is a sort of confluence of a couple different things. As I talked about in my introduction, the amount of LGA that we were sending out to local governments in 2022 without our modifications would be the same as the amount we were sending out in 2002. So let's all think about what's happened to the price of literally everything in the last 20 years. So our investments in our local governments are not keeping up with the cost of delivering services to our residents. We have a similar situation in education. If you look at the state share of education funding from 2002 to 2022, it's pretty flat. And so what has happened is that more and more of that cost is getting put on to the property tax levies that we all pay, whether we're homeowners or we're renters, by the way. And then in the last couple of years, we've had this huge increase in valuation in the homestead sector. And so obviously the way that levies work is it sort of like is within kind of the property tax base that shifts happen onto different categories of property. And so what we've seen is a big shift onto homesteads. And we respond to that in a number of ways in our bill, and specifically in Chair Lissagard's Property Tax Division report. There is $85 million of ongoing property tax refunds that go to homeowners. We have a one-time infusion, which we had space in our first biennium budget, and so we were able to respond to kind of the conditions on the ground today with a one-time infusion of property tax refunds for both homeowners and renters, and that's $125 million almost. The other piece is a bill from Representative Norris, which is special one-time targeted property tax refunds. And so what that one does, the other property tax refunds are targeted based on income, but this one, it's like whatever your income is, if year over year you saw a 6% increase in your property tax bills, then you're eligible for a refund. And so we really carefully designed the property tax refund approach in our bill to kind of meet those dual goals of both responding to what's going on today and what's been going on in the last couple years, and then also to help people on an ongoing basis moving forward. So there are a couple of issues with this proposal, unfortunately. This actually, when we adopted the Engen Amendment about reducing the film tax credit to pay for a sales tax holiday for baby products and school supplies that kind of puts these amendments out of balance, but we're sort of just having the conversation, but I wanted to mention that at the front. This excludes renters, which is a big issue from my perspective, because everybody pays property taxes. And so when we make changes to the homestead property tax refund and we don't include renters, we are further kind of reinforcing this inequity that already exists in the property tax refund system between those who own their homes and those who rent. Because if you own your home, the kind of threshold under which you receive a property tax refund is twice what it is if you're a renter. So that's an issue. And you know, I guess again, we're trying to take our bill into conference. We have a balanced approach to property tax refunds, to these credits. And so I would ask respectfully, Madam Speaker, for a no vote on the A55. Thank you.
Discussion. Representative Whitty.
Thank you, Madam Chair. I appreciate that, Chair Gomez, and I appreciate you understanding that the property tax on our Minnesota families are hurting them. Unfortunately, not every city gets LGA. And where I am honored and privileged to serve Lakeville, we do not. And so that is going to have an effect. I hope that is in part of your discussions as you move into conference and you understand it. And that obviously, I appreciate you understanding that. So thank you.
Madam Speaker, request a roll call.
Representative Koznick requests a roll call. Seeing 15 hands, there will be a roll call. The clerk will take the roll on the amendment. Will the clerk please call the name of the member who's voting remotely?
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 57 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Whitty moves to amend House Law Number 1938, the second engrossment as amended. The amendment is coded A59.
Representative Whitty, to your amendment.
Thank you, Madam Chair, and thank you for the leniency on the roll call freshman mistake, but I do ask for a roll call.
Good strategy. Representative Whitty requests a roll call. Seeing Representative Quam waving at me and a few other hands, there will be a roll call. Representative Whitty.
The A59 redirects $30 million from the St. Paul Street improvements, the public safety aid for our police and firefighters for mental health. As I spoke yesterday, our law enforcement is hurting mentally, physically, and also our firefighters. And this will be an opportunity to put some money into helping them with their needs. At my old department, they have a comfort dog that is around the department for scenes. We're seeing different programs started at our PDs and fire departments. So I would hope that you could support this amendment. Thank you.
Discussion on the Whitty amendment. Representative Pinto.
Thank you, Speaker. Thank you, Madam Speaker. This is working, yes? Okay, there we go. Representative Whitty, thank you so much, first of all, for highlighting the issue of mental health for our first responders. You've got firefighters in here and law enforcement officers as well, and grateful for that. In my work as a prosecutor, I see body camera video, and so get to see just from a distance what those individuals experience in their work, and I think that's such an important topic to highlight. I'll circle back to it, but I first want to, you've kind of connected here some some funding for St. Paul streets, and then with this law enforcement issue. So just to talk about the St. Paul thing, St. Paul is in a historic hole when it comes to repair of streets. I think we all have noticed this. I will say that today, there was a member of this body that had a blown tire when driving on a St. Paul street. That member did not mind my identifying, Representative Maria Perez-Vega. So this is something that a member of this body experienced just today. So you've all seen this, and there's many reasons for this. There were more than a decade of no property tax levy increase. They're now kind of digging out from that hole. LGA is not tied to inflation, but fundamentally, the fact is that our city has 1/5 of the property is entirely tax exempt, and we're in one place of that ourselves. So there's a real gap between the unmet need and the amount that is received under certified LGA, actually the largest in the state. And that's hundreds of $millions in deferred maintenance. And of course, it's really important that our city streets be paved, both for you and for the many visitors who come in. So St. Paul, in 1 month, has sent in more than $30 million in sales taxes, which actually equals the amount here. I'm grateful to Chair Gomez for including this provision in here. There is a 125-year replacement cycle right now in the street. So Summit Avenue was last replaced when the president was William Howard Taft. Little trivia question about when William Howard Taft was president, a long time ago. So I'm grateful that there is the funding to address this and to recognize the need that in our city, when visitors are coming to the city, we make sure that we have those paved streets. So would appreciate members' support regarding that. At the same time, it's so critical to recognize all that we are doing in the various budget bills that we are passing regarding our first responders and their mental health. Just yesterday in the public safety budget was funding authored by Representative Curran, for the development of first responder mental health curriculum. So we had that yesterday. There was the first responder equine therapy grant that Representative Kosnick authored. That was in the budget we passed yesterday. There was, of course, tremendous investment on our law enforcement in the budget we passed yesterday. Lots of mental health for public safety employees coming up in the bill on Monday from Representative Herr, House File 1234. There's quite a bit there. And then, of course, we have greatly increased funding for local government aid, for county program aid, thanks to Chair Liz Lagarde and Chair Gomez, that can go towards this as well. So this is absolutely critical. I should say just 1.2 on this amendment is that this amendment would not provide mental health support for our part-time and on-call firefighters who do such important work all around the state, and this would do nothing for them. So for all those reasons, members, I would respectfully request a no vote on the amendment. Thank you, Madam Speaker.
Discussion. Representative Robbins.
Thank you, Madam Speaker, and thank you, Representative Whitty, for bringing this amendment. You know, there's a lot I could say about this, but the first thing is that this is a direct appropriation to a city in the tax bill. It doesn't belong here. And I agree the roads in St. Paul aren't great, but that's really a local government issue. And the governor proposed $300 million in public safety aid. That did come to the tax committee, but it's not included in the tax bill. And so Representative Whitty is taking just 1/10, just a little bit, $30 million from an appropriation to fix potholes, and instead giving it to first responders for mental health. Because the governor's request was not funded. So members, this is an important amendment for all our law enforcement communities. The previous speaker said, you know, how important it is our streets are safe. I really agree. And our streets are safe when our first responders are getting the support they need to do their jobs every day. So please vote green.
Discussion. Somebody just stood up and waved. Representative Backer.
Thank you, Madam Chair. With what Representative Pinto said, we have to get started someplace, you know, and that's why I appreciate Representative Whitty's bill. We get started someplace, because if we continue to do nothing, nothing gets done. And like Representative Robbins just has shared, it is so important that we are able to support the individuals, fire, police, and ambulance that runs to our problems. So I will be supporting. I would ask other members to do the same. Thank you.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. Will the clerk please call the name of the member who's voting remotely?
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 59 ayes and 66 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Quam moves to amend House Bill number 1938, the second engrossment as amended. The amendment is coded A48.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker, and I won't be doing jazz or dancing fingers on this one. Members, I probably have the only district where I've got a large number of constituents outraged by 20, 30% or more increases in valuation or property tax. I'm sure it's just isolated in my district, which to the people watching, you know that's not true. Across the state, there's been a huge amount of this. And frankly, that kind of sudden and unexpected change is tough. It's a shock. What are you going to do for, paying the property taxes, et cetera? And that's one of the reasons why I did several bills with different approaches on how can we prevent that from happening. None got hearings, but the idea is we should not have huge shifts in property valuations or property taxes. A lot of people say, well, we've got refunds. You know, if we didn't have the huge shifts, we wouldn't be spending a lot of money on refunds. We wouldn't have people figuring out how to fill out this form and that form and then submit specially for property tax refunds. We should get it so that it's more predictable and we get rid of it. The easiest would be to say, put a 10% or lower cap on an annual increase. That's a logical thing. But local government and other entities don't like that. So being a math type person, I said, well, if we want to get rid of extremes, we do a 5-year rolling average, and that smooths out these bumps. I think the increase is fine on if somebody bought a piece of property and it's quite a bit more than what the evaluation is. You buy a piece of property, that's what you should be assessed at. And in the amendment I have where you keep, if it's purchased, then you go to that purchase price as the assessed value. That's what the market defines it as, and I think that's a good indicator. For all the other ones, you'd have a 5-year rolling average so that you would soften the increase. It wouldn't be these sharp changes. And I think that is a way we could get rid of the shock and not awe that we're seeing. At least that's what I'm hearing from a lot of people. And I think that's only fair. Predictability would be a good thing. And if we really tweak it in and get things right, then we can get rid of the extra forms to fill out for this property tax refund because it's such a much percent increase in this or that. A lot of people, they get confused about it. They want a bottom line. Let's do something for it. So I ask for a green vote.
Representative Gomez.
Thank you, Madam Speaker. Thank you, Representative Quam, for always bringing your most creative and interesting ideas into committees. This amendment was brought forward when we were doing the markup of the property tax division report. And I'm really interested in this idea, actually, and I hope that we can work on it more. Because I think that, when we look, when we were talking about Representative Whitty's amendment on property tax refunds, I kind of talked about what's happened in property tax valuations over the last couple years. And the way that kind of big increase in the valuation in the homestead sector has impacted property tax bills. And so that's what this is designed to sort of protect against, is that, like a lot of people who, even if they own a home that's getting more valuable, have a fixed income and don't have the liquid cash to pay some of these bills when there's really major kind of changes in them year to year. Unfortunately, I'm going to have to ask members to vote no on this today because, as we discussed in the division report, we haven't quite kind of gamed out all of the impacts that this will have on city and county and school levies, their interactions with tax increment financing and other kind of programs. And so this would be a really huge change to the way that our local partners calculate property tax levies today. And so it needs more work, and I think we should continue to talk about this. Representative Quam, again, about this issue of if there are ways to sort of safeguard against those huge kind of fluctuations year to year. But unfortunately, I think this isn't quite ready for us to implement this year. Thank you, Madam Speaker.
Discussion on the Quam amendment. Seeing no further discussion, all those in favor of the Quam amendment, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Zalesnikar moves to amend House Bill number 1938, the second engrossment as amended. The amendment is coded A44.
And before I have Representative Zalesnikar explain her amendment, we're having a little audio distortion, so people can make sure that their microphones are all the way in their spot. That might help. The member from St. Louis, Representative Zalesnikar.
Thank you, Madam Speaker and members. This is a simple amendment, and you've heard me speak many times. I'm sure you're tired of the topic of nursing homes. But the A44 just redirects $30 million from St. Paul Street improvement to the 300 nursing homes that are in the state of Minnesota. So I feel that it's relevant. The seniors that are in these nursing homes have paid taxes their entire life. And I've heard from many people that perhaps if we're going to legalize pot in Minnesota, that pot money goes to potholes across the state. So I hope members will consider this friendly amendment and allocate some money for the nursing homes so we can make sure that they are in a better position for today and tomorrow. Thank you, members.
Discussion on the Zalesnikar amendment. Representative Gomez.
Thank you very much, Madam Speaker. Thank you, Representative Zalesnikar, for your work on this issue. And, I think when we heard Chair Noor's bill the other day, we talked a lot about the needs in this sector, and the needs are real. And I'd want to acknowledge that, and that we have across our sort of care economies, we have a crisis. And, part of that is about wages, and it's about the extraction of profit from things like nursing homes and other forms of health care. That's a big concern. But, again, I guess I would ask members to vote no on this amendment. We did do some grants for nursing homes, again, when we passed the Human Services Bill. And, I just would go back to Representative Pinto's remarks. We have a lot of people who visit our capital city. We have very real needs. We have this infrastructure, public infrastructure that was funded originally by public money, and we have an obligation to maintain it. A 125-year replacement cycle on roads that are supposed to be replaced in like half that time is not acceptable. And and so I just we put this aid for St. Paul in here to acknowledge the fact that for our capital city. It's very important that every time somebody comes here, they're not getting a pothole. So I would ask members to vote no on the A44. Thank you, Madam Speaker.
Further discussion on the Zalesnikar amendment? Seeing none, all those in favor of the amendment, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Kosnick moves to amend House File Number 1938, the second engrossment as amended. The amendment is coded A45.
The member from Dakota, Representative Kosnick.
Thank you, members. Under this bill, there is a $30 million appropriation, as we've discussed, directly to one city. In this Minneapolis and St. Paul budget, under this tax bill, $30 million of that goes to St. Paul. And what the A45 amendment does is takes that $30 million that should have actually been appropriated through the transportation bill, which, by the way, increases taxes $3.45 billion. But this provision never got a hearing in the tax committee to give St. Paul $30 million. But what the A45 does is helps our small businesses, 50 employees and under, mostly average middle-class Minnesotans, helps them by creating a small business grant for businesses that are affected by a new paid family leave, earned and sick time proposals. We need, it's hard to understand, but the Democrats are so proud of their tax plan that's raising $9.5 billion in taxes on Minnesotans. Amazingly, we have a historic surplus, but our spending is out of control, and the people that are going to be hurt the most are our average Minnesota families and small businesses. And so the A45 amendment will create a grant program to help offset these businesses that are hurt by the $1 billion paid family leave plans. And so, members, I ask for your support in better using the appropriation for St. Paul. And, Madam Speaker, I would request a roll call. Seeing 15 hands, I still request a roll call.
Representative Kosnick, I was just trying to figure out your math on some of the things you were saying that I questioned. But your math on the hands is pretty good. There are 15, so there will be a roll call. Representative Kosnick.
Well, thank you, Madam Speaker. The math is we have a $17.5 billion surplus, historic surplus, that people in all communities across the state of Minnesota, and especially the people that I've talked to in the district I represent, we're expecting some tax relief with that over collection of revenues. The other part that's amazing, and it's hard to add up, I don't blame the speaker, $9.5 billion in tax increases. And then if you add in some of the fees on fishing licenses and things like that, it's probably closer to $10 billion. But anyways, I would ask members' support to provide some relief to our small businesses that are going to be facing and having to pay a lot of these tax increases.
Discussion to the Kosnick amendment. Representative Gomez.
Thank you, Madam Speaker. Thank you, Representative Kosnick. I mean, paid family medical leave isn't in law yet, so this refers to something that doesn't actually exist yet, so that's an interesting part of it. But we appreciate, the assumption that we will be providing workers in our state with this critical benefit that every other industrialized country in the world manages to provide for their employees, that a lot of places that are much less prosperous than the United States provide to their employees. Time to care for their sick relatives, time to care for their babies when they have a newborn. And so we also are looking forward to that moment when working people in this state are no longer outliers in the world in not having access to paid family and medical leave. And I know that we're going to have a lot of really great discussions about that next week. But for today, I would ask for a no vote on the A45. Thank you, Madam Speaker.
Discussion. Representative Koznick.
Madam Speaker, I would request the members' support with a green vote.
The clerk will take the roll on the A45 amendment. Will the clerk please call the name of the member who's voting remotely?
Richardson.
Okay, go ahead.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 59 ayes and 66 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Robbins moves to amend House File Number 1938, the second engrossment as amended. The amendment is coded A29.
The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker. I rise and request a roll call.
Representative Robbins requests a roll call. Seeing 15 hands, there will be a roll call. Representative Robbins.
Thank you, Madam Speaker. So the A29 cuts the bottom income tax rate from the current 5.35% to 2.8%. And this is funded, members, just so you're clear, from future surpluses. And we had this discussion on an earlier amendment. And I just want to explain why this is not a gimmick or a trick. This has been done in other states where they put in statute that this is a priority of how they want to do their tax code. And as surplus money becomes available, it is dedicated towards achieving that goal. Iowa has done this for reducing their income tax rate, and I know other states have done it as well. So this is not a gimmick. This is a way to do tax policy. And why it's important is because when you do have a huge surplus like we do right now, $17.5 billion, some of that money, if we already had this in place, would be automatically going to cut the lowest tax rate. And that is good policy. It's very broad. So back to, so I just wanted to address the gimmick issue. But now I want to talk about why we need this. So Minnesota has already one of the most progressive tax rates in the country. And part of the tax bill that is before the body today is creating a fifth income tax tier that would give us a highest income tax rate of 10.85%. Members, that gives us the second highest tax rate in the country. And already, where our current highest rate is at 9.85%, we're at the fourth highest. So we are an outlier on tax policy in terms of how high our income tax rates are. So our lowest tax rate, so this is the lowest tax rate for our state, is 5.35%. Members, that is higher than the highest tax rate in 24 other states. This is so uncompetitive. Our lowest tax rate is higher than the highest tax rate in 24 other states. So what this amendment does is it reduces our tax rate from 5.35% to 2.8%, and it will happen, admittedly, over time as surpluses are accumulated, and so it won't happen all at once. But it's very broad. It will affect every person who pays income tax in the state, and it will help make us more competitive. And I really think that we need to think as a body about tax policy. And generally, the idea of a broad base is the most fair. And so that is something that I think is missing in this bill. There are a lot of tax credits and a lot of tax expenditures, but it's very targeted at specific populations. And many of the people who will be receiving those tax benefits do not pay taxes. And so it's a way of spending taxpayer money for certain programs that are run through the tax code, even though those people haven't paid taxes and contributed to creating the $17.5 billion surplus. So members, this is really important because the way that when you have a lot of little tax expenditures like tax credits, it creates winners and losers. And it really is not creating a broad base for the tax code. And so I just want to talk about how this would impact some families in our state. So currently, if you're a family of 6 making $155,000 and have 4 children, you would not be eligible for the rebate checks that are in this tax bill before us. But if you live in the 7-county metro area, you would be subject to the 1% metro-wide sales tax increase that is in this bill. So your taxes would actually go up by $476. And you would be subject to the 75-cent delivery fee in this bill, which has been approximated to be a $150 increase in your taxes. And we are not counting the 30% increase on the tab fee or the payroll tax increases. But the staff did an estimate that that would be another $626 per year. So,
Representative Robbins, I just want to be sure your amendment, you're talking about the tax bill, not the transportation bill.
yes,
Representative Robbins.
Yes, thank you, Madam Speaker. I am tired. Those are some of those things are in the other bill. I'm sorry, but it's about the total taxes that are going into the budget that we have been debating on this floor day and night for the last 2 weeks. So members, I just want you to know that tax increases are going up all over the place for families, and they are not going to be getting the rebates or the benefits that honestly, they kind of think they would or they expected. All of us campaigned on returning the surplus, or most of us did, and it's not happening in this bill. And so, members, I'm just trying to provide some tax relief at the very lowest end of the tax code so that it'll make our state more competitive. It'll give a broad relief to families in our state, and it will create better tax policy for our future. So members, please support this amendment to reduce our lowest tax rate. I think I requested a roll call? Okay, then please vote green. You did it.
Discussion on the Robbins amendment. Representative Gomez.
Thank you, Madam Speaker, and thank you, Representative Robbins. I appreciate you bringing this bill forward. I wanted to just go back for a moment to this use of the budget reserve, which is frequently, as right now, right, 2/3 one-time money, and we're talking about using one-time dollars for permanent, ongoing structural tax cuts or spending. So in statute, these are all because there's a few of these amendments that use the November forecast as the source of the funding. And I just wanted to clarify that, you know, before any money would go to any of these efforts, any of these tax cuts, any of these expenditures, first, the cash flow account would have to be paid back, the budget reserve account, the school aid payment schedule to 90%, restoration of previous school aid reductions, and reduction of the property tax shift. Money would have to be transferred to the Minnesota 21st Century Fund. We would reduce or eliminate the June accelerated shift. So all those things would have to happen before any dollars would go to any of these efforts that are funded with the November forecast or the budget reserve. So, you know, we heard like, oh, it's not a trick, it's not a gimmick, it's not weird. I mean, it's a little weird. Maybe it's not a trick or a gimmick, but it's kind of weird. So that's on the budget reserve. And on the first, the reduction, the first tier rate cut, I think there's something that's really appealing about this, you know, because you hear like, oh, we're going to cut the bottom tier, the rate. That sounds like something that would mostly benefit like people who really need the help. And you talked about our progressive tax code in Minnesota, and that's true. We have one of the most progressive tax codes in the country, and I'm really proud of it, and we should all be really proud of it. Because it means that we're not disproportionately burdening low-income people with the cost of public goods. We're asking, those higher-income people who have been richly rewarded in this economy to contribute a little more to the public good. And as I've said, taxes aren't about punishment. They're actually how we care for each other in a community. They're how we care for each other in any geography, whether it's our neighborhood or our city or our state. Taxes are the reason that we have street lights, and they're the reason that when you call 911, somebody comes, and they're the reason that our kids have access to school, regardless of our ability to pay for it. And so we have a progressive tax system. And actually, when you take into account the fact that we conformed with the doubling of the standard deduction that happened in the 2017 TCJA, and we made that permanent, whereas at the federal level, it either has already, maybe it's going to expire in, I think, next year, but we made that permanent. So that means that we have more people than almost anywhere in the country who are in that lowest tax bracket, right, where they don't pay taxes between the standard deduction and the dependent exemption. And so because we have this really progressive income tax system, reducing rates even at that lowest tier doesn't actually benefit Minnesotans who need it the most. This was proposed previously, and the issue, one of the issues here, right, is that we don't know how much this will cost. I haven't seen a revenue estimate. We didn't have a hearing on this, so I'm not exactly sure how much of what the kind of dollar amount that you're trying to shift into that November forecast is. But what I do know is that I looked back, because this, is a proposal that's been around before, and of course, as Representative Robbins knows, we have this kind of the tax incidence study and this way of analyzing what the incidence of tax policy decisions would be. And the incidence study analyzes what income level certain tax policy choices impact. And so what they found was that the top 20% of income earners receive almost 40% of the benefits of a first-tier rate cut, and the bottom 40% of income earners receive 2% of the benefits. I'll say that again. The bottom 40% get just 2% of this benefit. So there's a little bit of like, if you read it, you're like, oh, low first-tier rate cut. You're like, oh, that sounds like something that would help out poor people. Well, that's not actually the case here. So, this isn't really ready to roll. We don't actually know how much the cost would be, but what we do know is that previous analysis shows us that this would not help like 500,000 of the lowest income Minnesotans. This spending, whatever it is, we're not sure, would disproportionately go to those top 20% of income earners in our state. And so it undermines the progressive tax code that we have, which is an equitable way to fund the public good, which is what I support and I hope we all are behind. And so I would ask for a red vote on the A29. Thank you, Madam Speaker.
Discussion on the Robbins Amendment. Representative Robbins.
Thank you, Madam Speaker. Thank you, Chair Gomez, for that discussion. And in case I haven't said it yet, I really have appreciated being on the Tax Committee, and I've appreciated your leadership. We've had really fantastic discussions in committee, and so I appreciate that we can have this dialogue on the floor as well. So I do want to go back to a couple of points that you raised, if I can read my money here, or my writing. So one of the things you said is that that you're wanting to see that the wealthy contribute, you phrased it as a little more to the state, even though we already have a progressive tax code. And so, and I do appreciate your citations from the tax incidence study, where you said that the bottom 40% of income earners would get 2% of the benefit. And I don't have my incidence study with me, but I will take you at your word. But one of the reasons for that, members, is because the people who have the lowest incomes generally don't pay taxes. So that's why they're not being affected by this, because they are getting a lot of tax credits and state aid, and so they are not paying taxes. So once you get to the level of the people who are earning enough income and are paying the taxes, then it's a different story. And that is where our middle class families are, and they are paying a whole lot of taxes. So one of the things that I think a lot of Minnesotans don't know is that the top 10% of Minnesota households, which are those earning more than $164,000, they pay 60% of all of the taxes in the state. So the vast majority, as the chair already said, of the middle class and upper income families are the ones who are paying for the tax burden in our state. So this is just a way, members, to reduce the tax burden for the lowest tier that would help those families who are already paying the lion's share of the taxes in the state, and then it would also make us more competitive. So I really urge members to support this. It's common sense tax policy. We wouldn't get there overnight. And to her point earlier, where she listed all the things that would have to be paid for first, the cash flow, the budget reserve, the rainy day accounts, all those things. That is absolutely correct. But members, those things are fully funded right now, and we have a $17.5 billion surplus. So we have shown that those things are there, and we already have this huge surplus. So I'm just saying, let's use some of the future surpluses to whittle away at that lowest tax rate. It would help families. It would be a broad-based tax policy, and I urge a green vote. And if I didn't ask for a roll call, roll call.
You did request a roll call. There will be a roll call. Any further discussion on the Robbins Amendment? Seeing none, the clerk will take the roll on the Robbins Amendment.
Hey.
Will the clerk please call the name of the member who's not yet, or who's voting remotely?
Richardson.
Richardson votes no.
Richardson votes no.
I think her granddaughter said no, too. The clerk will close the roll. There being 57 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Hudson moves to amend House File Number 1938, the second engrossment as amended. The amendment is coded A30.
The member from Wright, Representative Hudson.
Thank you, Madam Speaker. Members, the A30 amendment would have the effect of requiring future increases in rates, income tax rates, to be approved by the legislature by 2/3 of the members of each house of the legislature. And the reason why I'm bringing this is I'd like us to reflect upon, it's really easy in the work that we do here where we're tossing around numbers in the millions and billions to lose track of what just one of those units means. What is $1? Every dollar represents value. That's what it's there to transact, what it's there to represent. and that value was produced, and it was produced by a person. I heard an interesting turn of phrase from Chair Gomez earlier, talking about those in the upper income tax tiers as being, quote, richly rewarded, unquote. It's interesting language, richly rewarded. I've never regarded one of my paychecks as a reward. It wasn't a prize. It wasn't a grant. It wasn't something that I was given. Every paycheck that I've received has been earned. It's been payment for value added to an employer. And that's true of Minnesotans everywhere, regardless of what income bracket they fit in. Minnesotans earn their money. It's theirs. And every time we appropriate a dollar, we are taking not just the money, but what the money represents. Value that they spent time and effort and applied their intellect to produce. We're taking that from them. We're appropriating it. That's literally the word we use, appropriating their productivity, their labor, to redirect it to what we think it ought to be spent on. And I think that that decision ought to be made with a high degree of sobriety and respect for the audacity of being able and willing to do that. And I'm also interested in trying to advance the goal implicit in the slogan of One Minnesota. I think that a lot of Minnesotans feel like they're getting a lot of stuff that they didn't ask for. A couple of examples that come to the top of mind would be increases in vehicle tab fees, delivery tax added to every order, $9.5 billion in taxes increased overall with a $17.5 billion surplus. These are things that no one was asking for at doors that I knocked or at fairs that I attended, on the side of the roads and parades. Nobody was asking to have their taxes raised by $9.5 billion, but we're giving it to them. It doesn't feel very One Minnesota. It doesn't feel like we're taking everybody's values into consideration. One thing that we commonly do here when we talk to folks out in the public is we hear a desire for bipartisanship. We hear a desire for us to work together across the aisle. And it can be difficult to explain to folks why that does and doesn't happen. But one thing is for sure, there's been a shift that's broadly recognized in recent years away from bipartisanship towards sticking into our corners. I was talking to one of our more senior members yesterday, having a chat, and he was reflecting upon a past session when he was a chair of a committee, and the practice that he would have of intentionally engaging with the minority and even offering them bills and saying, hey, why don't you carry this? With the objective of getting to this stage in the process with a bill that had broad bipartisan support. That was a goal. It's a past goal. It's apparently not a current goal. And that's unfortunate because people want that. And again, the slogan of One Minnesota seems to imply that we're going to get broad agreement on the direction that the state is taking. And so that's what this amendment tries to effect. What I'm saying is that if we are going to raise tax rates on Minnesotans, at least 2/3 of us ought to be on board with that idea. And look, if you still want to gang up on the people who you feel have been richly rewarded, who you feel have earned too much, who you feel don't need it, you can still convince 2/3 of people, 2/3 of elected legislators, if that's what their constituents want, to gang up on the other third. We can still do that. But what this provision does is, at the very least, assuming that we're not going to have a super majority of one party anytime in the near future, ensure that when we make that decision, we're doing so in bipartisan fashion. So I'd ask for a green vote.
Discussion on the Hudson Amendment. Representative Gomez.
Thank you very much, Madam Speaker. So just quickly, when I talked about those highest income earners being richly rewarded by the economy in Minnesota. There's data to back this up. Those making $500,000 and more a year over the 2019 to 2021, their incomes more than doubled, went up 117%. People realizing capital gains during the pandemic went up 147%. During that same time, that time which I don't need to remind us about, but I'm going to, a time of unprecedented unemployment, a time of suffering, pain, death, literally, in our communities, a time when frontline workers from so many sectors were putting their health on the line and the health of their families on the line. During that time, when people were having trouble making their rent payments, when more Minnesotans than ever were visiting food shelves, during that time, people making $500,000 and more, their incomes went up 117%. During those years, the value of the stock market went up trillions of dollars. Trillions of dollars. And here in Minnesota, capital gains went up 147%. At the same time, the lowest income Minnesotans saw their income go down by almost 10%. And when we talk about all economic activity happens in the context of the world, the community that we exist in, which, as I mentioned, is heavily subsidized by the public. The roads, the streetlights, the emergency services, the schools, care for our elders that we all count on. This is the public good. And no, I don't think it's punishment to ask someone whose income doubled during one of the most profound economic crises, certainly of my lifetime, to ask them to pay a couple dollars extra is not punishment to me. And to acknowledge the reality that there were winners and losers in our economy is just that. It's just acknowledging reality. It's just saying by the numbers, there were winners and there were losers. And there are people who have not recovered. And the recovery has not been equal. It has not been equitable. And so I stand by that. I believe that, again, that this is how we take care of those among us who need a hand. It's easy to be like, oh, taxes are terrible, but like, let's talk about what taxes buy. What's terrible about it? What are you going to cut? Is it the kindergartners? Is it the streetlights? Is it the fire response? I mean, you know, we all want to talk about like these, so, you know, we're all free market believers until you really get into the details of what that means. Like, should only people who can afford it be able to send their kids to school? Should communities only have access to roads and the post office if they can pool their resources together and support those public services? Because my community could do it. We could come together and pool our resources and pay for a post office. Is that true across the state of Minnesota? That's what the public good is. That's what our taxes buy. As to this amendment, I guess, you know, California requires a 2/3 vote to approve taxes. The US Senate requires a 2/3 vote for most things. And personally, I'm not for gridlock, so I would recommend a red vote. Don't be like the U.S. Senate. Don't be like California. Thank you, Madam Speaker.
Discussion to the Hudson Amendment. Representative Hudson.
Thank you, Madam Speaker. And Chair Gomez, I appreciate the fact that not only can you recognize creativity, you can also engage in it. That was very, very entertaining. Look, changing the threshold from 50% to 2/3 in no way prevents us from doing any of the things that you described. But setting that aside, I am interested in responding to some of those points. And actually, I'll start by introducing one that I think is a glaring omission from your consideration, and that's the concept of sustainability. Because again, the question of what should we cut, what public good doesn't deserve to be funded, is really a secondary question that needs to come after the primary question, which is, where does this money come from? Where is it? And how did it get there? And how are we going to obtain it? And how sustainable is it year over year, biennium over biennium, session after session, to continue taking more and more of it from the people who produce it? And the answers to those questions will determine, or at least set the stage for, our consideration of your questions, Chair Gomez. You speak of the pandemic, which is an interesting pivot, and all of the increase in economic disparity which took place as a result of that phenomenon. That's an interesting perspective. I think it's worth noting that the COVID-19 virus didn't shut down a single business. The COVID-19 virus didn't lock us in our homes. The COVID-19 virus didn't shut down our schools. It didn't arbitrarily select which workers were essential and which ones weren't. It didn't arbitrarily decide what big corporate businesses were worthy of remaining open while the rest of Main Street and small businesses were closed. COVID-19 didn't decide that. The state of Minnesota did. And I don't want to be called out of order, so I won't evoke any particular person, but we all know how our government works, right? Okay? And the responsibility wasn't just held in one particular office, it was held by everybody who was in this chamber and the other one at the time, because you all could have stopped it at any point and made life better for all those people who you're now talking about, whose lives have been made worse as a result of the government action that was taken to halt their ability to produce what they need in order to live. You're actually making my point. People need to work in order to make money in order to live. That's where money comes from. So maybe we should respect that more before we make such broad, sweeping, deeply impactful decisions. And that's what this amendment is trying to accomplish. Let's have deeper consideration. Let's have broader support. Let's broaden it out from one person deciding that everything shuts down to making sure we actually have a broad conversation and broad agreement on policies that impact everyone in this state. I'll ask for a roll call vote and ask you to vote green.
Representative Hudson requests a roll call. Seeing 15 hands, there will be a roll. Any further discussion to the Hudson Amendment? The clerk will take the roll on the amendment. Will the clerk please call the name of the member voting remotely?
Richardson.
There you go.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 56 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Olson B. moved to amend House File Number 1938, the second engrossment as amended. The amendment is coded A25.
The member from Martin, Representative Olson.
Thank you, Madam Speaker. Members, this amendment's very simple. We talked a lot today about promises that were made to different people groups, to different individuals, promises that were made to voters and our constituents. There was another promise that was made. It was a promise by the city of Minneapolis that they would, in fact, pay a portion of the stadium. There are conversations being had right now, and there's language in this bill that would basically allow Minneapolis to be off the hook should the state of Minnesota pay for the stadium early. They would let them off the hook for the remainder of their obligation. Now, members, we've talked about how in this House, in this area, bills are moral documents. Well, there are actually legal documents that say we, in fact, need to do something. The city of Minneapolis should not be let off the hook when we're talking about a stadium, especially given that in the near future, our stadium will need maintenance. We will, in fact, have to spend money to upkeep this excellent way of bringing people to our state. It's a great thing. It's a great asset, and it's amazing that our charities have been able to really carry the state in paying for this stadium. If we do, in fact, pay for it ahead of time, the city of Minneapolis should not be let off the hook. The city of Minneapolis, who has been blessed to have this stadium, should, in fact, devote that monies, that fund should go towards the maintenance of that stadium so that years from now, when that stadium does, in fact, need some maintenance, we don't see the city of Minneapolis asking the state of Minnesota for funds to assist them in maintaining that building. If we take this money, put it in the reserve account in order to utilize it at a later date for the maintenance of this stadium, as the occupants of that stadium have asked, we will not have to revisit this conversation at a later date. They will, in fact, have the money available to maintain that stadium, and we will not have to sit here on the House floor years from now when the ancient sages of this room can stand up and say, I was there when we had that conversation. We won't have to have that because, in fact, the money will already be there because the city of Minneapolis signed a legal, not just a moral document, but a legal document saying that they would, in fact, fulfill their obligations. Let's have them do that. Let's make it so that the sages of the floor of the Minnesota House of Representatives does not have to come up and say, I was there when we had that discussion. Let's just not have it. Let's have Minneapolis fulfill their obligations. Please vote green. Thank you, Madam Speaker.
Representative Olson, did you just call Representative Nelson ancient? Representative Gomez.
Thank you, Madam Speaker. It was nice of you to call him a sage, too, I guess, as long as you're going to go down that road. So I would ask for a no vote on this. The city of Minneapolis is on the hook over the course of this deal of 25 years for $1 billion. $1 billion. I've lived in Minneapolis almost my whole life. I've actually never even been in the stadium, but my kids and my grandkids are going to be paying for it under the current scheme. So, you know, there is talk, because of the balance in the stadium reserve, of renegotiating this deal. So, you know, there's talk of paying off the bonds early. And if we're going to renegotiate this deal, then we're going to address the fact that the city of Minneapolis, in owning this, is paying for this statewide asset to the tune of $1 billion. But I do agree with you. So this is a $1 billion facility, and my understanding is that like every single piece of it basically is custom made, because it's not like there's like US Bank Stadium store that you can go to. And over the course of the 25 years of this deal, of course, Minneapolis is paying into capital improvement reserves, but it's $73 million over the 25 years, which is not adequate to maintain a billion-dollar facility where every single piece of it is custom. And so, so I agree with that part, and that's very much a part of these conversations. The stadium exists. I wasn't personally here, when it happened, but I will tell you that if the terms of the deal are being renegotiated, then we're going to just take another look at whether it makes sense, once the bonds are paid off, for Minneapolis to continue to pay on bonds that are paid off. We're going to have this conversation about how it is that once we're in, right, we've created a public agency to own it, so it's like a publicly owned facility. And we know that these things always kind of degrade over time and that the public will be on the hook for this if and when that happens. Not the billionaire guy who lives in New Jersey, who's the one really benefiting from this, whose asset that he owns, this team, is appreciating in value because of this public money that he's gotten. But the people of the state will be on the hook if we don't figure out how to properly maintain this. And so on that, we are very much in alignment. And, I want to assure you that as these conversations move forward, that's a part of kind of the deal that needs to be looked at. Because there are sort of a number of strange things about this deal, let's say. So I would ask for a red vote on this. These conversations are ongoing. If you have insight about maintenance of the facility, please let's talk, because I saw that and I was surprised, honestly, at how low it is over the course of the kind of useful life of this facility. So thank you, Madam Speaker. Thank you, Representative Olson.
Discussion. Representative Olson.
Thank you, Madam Speaker. Thank you to the chair for the very candid conversation about, I'm very appreciative that you are taking this into account, understanding that we have made agreements, we have agreements with each other, we have agreements with other cities, and that there will in fact be maintenance requirements. So I very much appreciate that. With that being said, I would appreciate a roll call on this amendment.
Representative Olson requests a roll call. Seeing 15 hands, there will be a roll call. Representative Olson.
Thank you, Madam Speaker, and thank you to the chair for recognizing that we do in fact need to meet our obligations, and I appreciate the conversation of continuing to discuss those obligations. I think, though, that this needs to be stricken from the bill today so we can continue those conversations without tying our hands up. And for the record, Madam Speaker, a sage does not necessarily have to be ancient.
The clerk will take the roll on the Olson amendment. Will the clerk please call the name of the member who's voting remotely?
Richardson.
Richardson votes no.
Richardson votes no.
The clerk will close the roll. There being 58 ayes and 66 nays, the motion does not prevail. The amendment is not adopted. Representative Long.
Madam Speaker, I move a recess to the call of the Speaker until 7 p.m. sharp.
Representative Long moves a recess to the call of the chair until 7 p.m. sharp. Representative Long, could you define the word sharp? Representative Long.
One more time, Madam Speaker.
Could you define the term sharp?
Bright and intelligent as per C. Speaker Hortman.
I meant more in the nature of exactly. Representative Long moves a recess to the call of the chair until exactly 7 o'clock. All those in favor, please say aye. All those opposed, please say no. The House stands in recess until 7 o'clock. Nope.